Hello, good evening. Assalamu alaikum. How's everyone?
Walaikum salam, Dr. Zaid.
How are you doing, Palak?
I'm fine. How are you?
I'm good too. I'm good too. Alhamdulillah.
Good to see you again.
Yes, definitely. Hi, Mariada. Hi. I hope you guys can see me. Hmm?
Yes.
Okay, fine. Uh-huh. Mhm. Okay, that's good. So we are just going to start our session in a while. Okay. So just be there and we will just starting. So before that, if you guys have any question, anything, you guys can ask me. Hmm.
How to prepare in this short time?
I will be talking about it, so don't worry about it. Okay, so I will be telling you all tips and tricks. The problem is that we are so scattered. We are not the kind of focused in our preparation. And once you are scattered, once you're not focused, of course the preparation looks so in fact difficult. So what you have to do is that you have to be focused. You should know what your syllabus is. You should know that how you are going to start your preparation. Then go on with the preparation. That is the basic step. So I'm sure you guys are on track now, Falak, because I can see that you are progressing day by day. So this is all we need. This is all we need. That we do need to practice in this exam first of all, because this is all about how you behave, how you communicate, and on top of you are going to blend with your applied technical knowledge. That's it. So this is how we have to do in this exam. So the problem with many candidates is that even today I was talking to one of my friend, that we rely on ready-made things. We rely on the ready-made things. So we can't rely on so many things. For example, for part 3 we are relying on templates. Yes, it's going to help in a way that it can give us idea about what exactly the exam is. But do you really think that you can memorize all those lines and then you can just utter those lines? Palak, do you think it is practically possible?
No.
No, right? Because in exam you have to be so spontaneous. You have to
Yes.
be like, I mean, you never
Nat-
know what the role player is going to ask you, what examiner is going to ask you. If you have everything in your head because of those the templates, so what will happen by the end is that you are going to lose your marks. You are going to lose your concentration. Perhaps you will come back, okay, in the same station, but of course you are going to lose few of your the precious minutes. So yes, templates do help. This is what I believe, that they do help, but don't rely on them, because this is not what our exam is. This is not what, because what I think, how I speak, probably you are speaking much more better than me. So you can't compare yourself with me. I can't compare myself with you. Of course, everybody has the different pattern. Everybody has different way to communicate, different way to speak. Okay, because at the moment I'm taking classes, so I can see I have got the brilliant candidates. Everybody has the different and strong points. Few are very much strong in their applied clinical knowledge. Few are very strong in communication skills. Few have very good the kind of tone and pace. This is not about the English language. Moreover, this is all about how you behave in exam, because this is not occupation English test exam. This is just MRCOG part 3. Similarly, like, I mean, we all have been going through all exams throughout our life, I must say, part 1 and part 2, and then yes, part 3 as well. Okay, I will be talking about it in bit detail, but before, because I can see I have many new candidates with me, so of course I would like to bit more, kind of talking to be in detail of the exam, the Osler system, and of course I will be giving you the tips and tricks how to prepare for this exam. Okay, so don't worry about it. And on the other hand, I'm here, and you guys know me that I'm easily approachable, easily reachable. So you guys can reach me out anywhere. And of course, I'm on Facebook, I'm on Telegram, I'm on WhatsApp. So you guys can reach me out, and if you guys need any kind of help in terms of anything, even you guys can discuss anything with me. It's not all about the exam and the courses or anything, because we all are colleagues. And of course this online world has brought everyone of us together. So we don't know anybody personally. Perhaps, you don't know me, I don't know you personally, but yes, we are connected through this online world. So I think, we have to be very much, connected in this way that, one should be easily approachable. Okay. So, so I think let me have, wow, I can see Salma. How are you, Salma? Good to see you.
Yes, fine. Thank you. Assalamu alaikum.
Walaikum assalam. Walaikum assalam. So good to see you. So good to see you.
Thank you.
Okay, that's
Nice to
great.
meet you.
Same, same, same. Okay, so I can also see Fatma. So finally, I'm going to see Fatma. So yes, Palak, Tanya, and Maryada, Manahil, and everyone. Yes, I know them all, but I do try to be. I do try to be because although I work, Palak, that I work as a consultant as well. So of course, but online thing is that you can be connected at all times, through mobile phones and anything. So of course, and this give me an opportunity that I can be more close to my all candidates, and in fact, I don't call them candidates. In fact, we all are friends, kind of, because sometimes our journey is kind of bit delayed, and perhaps we all are like, I mean, kind of in the same boat. So it's not like, I mean, that we have to be like, I mean, stiff in our anything, like, I mean, we shouldn't be behaving the rude or something like that. So because part 3 is all about the exam of nerves, that how you are going to control yourself, okay, how you are going to the kind of be composed. I mean, not only in your preparation, but of course in your, exam as well. So, so I think we are on Facebook now. So I think we should start. So first of all, you all know me. I'm Dr. Zaid Qureshi. Okay, so I will be giving you an overview of MRCOG Part 3 exam. So this is going to be an overview. Plus, I will be telling and talking to all of you with a few of the tips and tricks to pass this exam as well in a very, the good way. So this is very prestigious building of RCOG, and every one of us wants to go there. Have a picture. This is a new building of Union Street, RCOG. Previously, we used to have, the Regent's, the Park building on the RCOG. I'm sure you all have seen many of our, the colleagues having photos with that, the particular, the mark and the particular thing that RCOG rooms on the Regent Parks. Okay, so this is the new building of RCOG Union Street, and perhaps because things are going very smooth now, and since COVID is getting easy, so of course we can go, inshallah, you guys will go for your convocation once you will pass your part 3. And I have high hopes that anybody who really works hard for this exam can easily ace this exam. Okay, so this is a big question, candidates do ask me, and that when and how we have to attempt this exam. This is very the crucial and important question, isn't it? So at least you have to attempt your part 3 within 7 years of passing part 2. This is very much important. And then second question arises, it how many attempts? So yes, we have got 4 attempts to pass this exam. Okay, if somebody doesn't clear part 3 in 4 attempts, so unfortunately he or she has to give part 2 again. Okay, not part 1 but part 2 again, and then start with the same journey. Okay, so all you have to do is that you have to prepare with full throttle. You don't have to leave any loophole. So at least make yourself in such a, I mean, prepare yourself in such a way that at least you ace this exam in first go. Okay, but again, it's not all about the passing exam. Of course, passing exam is important. Okay, but you don't have to the kind of make this thing in your head at all times that yes, no, I just have to study to pass this exam. Yes, passing is exam is very much important. On the other hand, your mental health is important too, your physical health is important too. It's not like that all the time you will be thinking about this, that what if I fail this exam, what if I don't ace this exam in first go. So what, I have failed this exam, but I'm here. Okay, so failing an exam doesn't make anybody inferior. Failing an exam doesn't make anybody the kind of a bad the candidate. So failing an exam, it can be, because, we all, I believe that, whoever fails this exam fails with margins, because almost we all are competent doctors all around the globe. Okay. So if somebody is failing with margins, so I don't think that it should count. Okay. Yes, it hurts. Definitely it hurts. I've been through this phase, and it is, the kind of, the hurtful period and the painful period as well. But on the other hand, this way or that way, we have to move forward. We have to study hard again. We have to go for this exam again. We can't leave this exam in the middle. We can't leave this exam in a way that, we are just going to leave it after passing part 2. Because, the more gap you will take, the more, the applied clinical knowledge you have to revise, because the guidelines are going to change. If we are going to have, the new talk articles as well, then of course, what is the idea of delaying this exam? Yes, I understand that, booking process is cumbersome these days, getting a ticket is cumbersome these days, but if you get a chance, so I think take a chance and then just go for it. Prepare well for it, and then, just give your 100% and leave everything, because then there is going to be luck as well, isn't it? It's not like that, we go for the FD exam, and that every candidate is going to pass. Of course, there is going to be a criteria, isn't it? So 4 attempts, and after failing 4 attempts, one has to give part 2 again. So what exactly is part 3? So part 3 is, is the aim of the part 3 is to assess the candidate's ability to demonstrate core clinical skills in the context of skills, knowledge, attitude, and competencies as defined in the MRCOG Part-2 curriculum. So it's a final step in becoming a member of the prestigious Royal College. So this is how you will look finally. And this is how I was on my graduation ceremony, when I received my degree. So I'm sure all of you will be, posing and taking the pictures in same way. So, okay. So this is a kind of, the very, this is a beautiful RCOG badge, which we do get on our ceremony day. This is gown, this is cap, and I'm sure everybody is familiar with that. Okay. So yes, this is a kind of final step towards our, the prestigious membership of the Royal College. So we have to work hard for it. So what exactly the exam is? So exam, we all know that, we will be having total 14 stations. 14 stations are going to be in one row. Okay. So this is going to be a kind of a circuit. So because in online exam, there is going to be 7 stations, then, a small break, and then 7 stations again, because of the online system. But moreover, if it is physical exam, then it's not going to be, there is not going to be any rest station. So they are going to be in a circuit, one after one, 14 stations. So usually we get 2 minutes time. That is going to be the reading time. Reading time means that in the 2 minutes, you are just going to read the question, and I will tell you what, how, and when, and, what is going to be the, the good way to read, to utilize those 2 minutes time. So usually it's going to be 2.5 minutes in the online system. Half minute is going to be for like, switching from one station to another station. 10 minutes is going to be for the performance, and usually that's going to be inside the cubicle. Inside the cubicle means where you are going to face the role player in terms of if it is a simulated patient task, or you are going to face the examiner if it is a structured discussion task. Usually 5 to 6 are structured discussions. Rest are role players. Out of them, 4 are going to be with lay examiners. So whenever lay examiners are going to be there, this will carry a highest marks. And usually lay examiners are, as name says, that they are going to be lay examiners. They are not going to be the medical professionals. They can be lawyer, they can be teacher, they can be, out of our, the field, out of this, the medical field or something. So they are just going to judge our attitude, our performance, our behavior, that, how a layman judges us when we speak to, our colleagues or anybody else. So this is how they are going to give us, the numbers. So whenever you are going to see the lay examiner, so this is going to carry highest marks in that exam. Some of the stations can be linked station as well. Okay, like in my exam, there was, the linked station, in a way that, the first station was, the lady has developed, the OHSS after IVF. Okay, that was the first station. Then the second linked station was that the lady you have spoken to in the previous station, Now she has become pregnant. Now she is 32 weeks. Now she is here to discuss her plan and mode of delivery at 32 weeks of gestation. Okay, so some of them can be linked station. So if they are linked station, so they are going to tell you, it's going to be written there. So you don't need to worry about that. There is not going to be a rest station, but like I have told you earlier, that in online system you can have the a small break, and then you will have the kind of the next stations. Usually it is 168 minutes and it is over, but in online exam the time can be more, because there can be some internet glitches, there can be some problem at the trainee candidates and or the examiner ends or anywhere. So sometimes there can be the rerun of the station as well, and usually that happens after complete exam. Okay, and plus if you are not satisfied with your the internet speed or internet or something, that where you had some kind of difficulty in reading the station in the 2 minutes, or you had difficulty in hearing or something, any internet glitch, you can appeal by the end of your the exam, and you can say that the task number 6, I could not hear the role player, I could not see the instructions. So yes, then they will see, and then they will check that whether it requires rerun or not. Okay, so yes, rerun are there, and this is the good chance that but in rerun you are not going to get the same station. In rerun you are going to get the changed station. Okay, so yes, in online exam time can be more, so all you have to do is that you have to be prepared for online exam, because in this May exam as well, this is going to be online, and perhaps in November exam or the next attempt, this is going to be the physical exam. So usually the online exam is computer based oscillator system exam. You will see candidate, role player, structured discussion, examiner interaction. Everything will be through the video conferencing, like we are talking to each other at the moment. But of course, it's going to be on a system, and they have given the name as oscillator system. This is not an app. This is not something which you have to download on your the laptop or desktop. Okay, this is just a system in which you have to enter, you have to give your exam, and that's it. You don't have to do anything. It is going to lead you, it is going to like direct you, that how you are going to move forward in your the successive stations. So this is a kind of the online exam with remote vigilation. This is how it looks, and all you need is a strong internet, and with the help of the internet, like we are connected at the moment, so you are going to be connected to the all examiners, role players, and the RCOG as well. So on the day of exam, what you have to be worrying of, apart from your the presence, apart from your the preparation, all you need to worry is about technology. That's it, because this is online exam, isn't it? So of course it is your responsibility to have a good internet system. This is very much important, and RCOG will tell you that which system needs to be on your laptop or desktop. I will be showing you in upcoming slide. Okay, so all you need on the day of exam, I will repeat again, all you have to be worry about, all you need to worry about is technology. That's it, internet. Then this is important. These are the technology checks which have been given by the Royal College, and it's available on their website. So I did try to rephrase them. You have to check your browser beforehand. Usually it should be Windows 7 or newer one. Okay, so if it is like the Apple, so it should be Sierra 10.12 or newer one. Google Chrome web browser should be used only. That's it. And your Chrome should be up to date. You have to use desktop and laptop, but you cannot use MacBook or mobiles, okay, or iPads or anything. You can't use them. Remember, you have to use desktop and laptop. If laptops are there, so inbuilt camera, or the camera should be there even with the desktop as well. Make sure you give access to the oscillator system for the microphone, for the use of camera, and whatever they ask you. Over the head headphones should be used, not like this what I'm using at the moment. Okay, over the head headphones. So it is very much important, because it will mask the noises from outside, and you can hear properly, you can focus properly, and you can see properly. So headphones with a microphone in the cord, like iPhone headphones, should not be used as they can scratch off clothes and hair and will cause, the feedback. For Osler system, you don't have to download any system. Yeah, you will just log in with the given details and that's it. You will get given details. Okay, you will get your ID, you will get a password to log in. Okay, and you will get an email before exam date, 4 to 5 days perhaps, or 1 week or so. They will send you that how you are going to check your system. So you have to check your system beforehand. Make sure the system you have checked earlier, so you will be using the same laptop or desktop on the exam date as well, because it is important, because the same device, it is very much important, because you have to check the connectivity. The connectivity needs the speeds, internet speed. Usually it is 1.5 mbps, which should be supported by most broadband and the fiber internet providers. So if you are aiming for this May exam, make sure that you get the strong internet system. Okay, and usually in many countries we have got the fiber, the optic cables as well, fiber net, you can say. It is very much important. And even if you are using any of the internet, so make sure it has got good speed uploading and downloading. For the speed, we have got plenty of you can see the applications as well, by which you can check speed as well. And I'm sure one of your the siblings or anybody from your family can check it for you, even if you are not that tech, the kind of a person. So if you are working at NHS, remember not to use NHS Wi-Fi, because it can block connectivity, because NHS Wi-Fi is not going to accept the microphone and the camera, and it is not going to give the access as well. Okay, so I hope it is clear. Is it clear so far that how it is going to work? Okay, fine. That's great. That's great. So on the day of exam, what you have to do? What you have to do? You will log in. This is going to be your first step. Then there is going to be system check. With system check, the Osler system is going to check your, the desktop or the laptop. They will check a camera, they will check microphone, they will check connection, they will check quality of the internet as well. If everything is okay, they will give you green signal, and then you can enter into the exam system. For example, this is going to be a message afterwards. If they have given you green signal for this, your system check, then they will give you this, that, okay, hello candidate, you are ready to go for this exam. Welcome to Osler Online. Then you will proceed. You will click to this proceed, and then you will enter into the exam hall. So in the exam hall, because it's going to be a kind of waiting room. Waiting room means that you are going to wait, because sometimes, of course, because the circuit is going to be for 14 candidates, so perhaps you are going to start from station number 6, the other candidate will start from station number 1, the other candidate will start from station number 14. So that's how they will rotate. Okay, so you may have to wait for the couple of minutes, and then the real exam will start. That's going to be the reading time. Reading time means the 2 minutes reading time. 0.5 minutes is going to be for switching, because it is online system. So in 2 minutes reading time, you have to read the instruction, you have to read the given scenario, the station. All right. And then that's going to be the exam time in the next 10 minutes. And that's how it's going to repeat for good 14 stations, 2 minutes reading time, then exam time, then 2 minutes reading time, then exam time. In online exam, you will have 7 stations in a go, then a small break, then 7 stations again. But in physical exam, we never used to have any kind of break. So it was in a one go. So by the end, you are done with your 14 stations. So yes, the last step is going to be log out. So you will log out. So don't worry about it. The system is very easy. It's not like, the kind of a difficult thing that, how you have to understand the system. So I can, I get so many messages on this thing that, ma'am, we are very much apprehensive for this online exam, that, how it is going to be. So I hope it is clear now that, this is not bad at all. This is not difficult at all. This is very easy. All you have to do is that you have to follow the instructions. Okay. You have to follow that how system is taking you through the exam process. All right. Clear, everyone? On top of all you need is good internet. That's it. If internet is good, it is going to lead you through smoothly. Clear, everyone? Yes, Humaira. Yes, good to see you. Thank you so much. System is very friendly. Yes. It will guide you. It will guide you, how you are going to proceed. Okay. So don't worry about it. All right. So don't be apprehensive. Just focus on your own preparation, that how you are going to prepare for your exam. Don't worry about system. Don't worry about online thing. All you need is good internet system. That's it. Okay. Okay, great. Okay, then this is how the system will look. Moreover, okay, so this is you, the exam candidate, and this is how you will see this, the station or the question in front of you. Okay, and this is how you can scroll up and down, the things. And this I have taken from RCOG official, the video on the OSCER system. So this is the courtesy from the RCOG. So on the front, you will be seeing the time zone as well, time limit. Okay. So you will be seeing that, 2 minutes have, out of 2 minutes, how many seconds are left. Okay. So you will be seeing that. So don't worry about it. So this is how it will look. Okay. This is going to be the reading time, and the time will start like this. You can scroll if there is only one station without any labs or something. So yes, I mean, you can see, you can even maximize this screen. You can even minimize this screen. So this is all up to you. So don't worry. This is going to be very easy. Okay. And this is how it's going to be once role player appears. This is you, exam candidate. This is the role player. This is how the examiner will be on the window. You can see the examiner as well. And if there is a lay examiner, so you will see lay examiner as well. And in here, in the last window, even, you can write whatever you want to write. But personally, I believe that, it is very hard that, you will write something, because many of us are not that the technology friendly or something. So I will suggest all you have to do is that you have to be reading the question again and again, so you are not going to miss a tiny thing in your 2 minute time. Because some of the time what happens is, let me give you an example. Recently we have conducted a circuit course, okay, for the part 3 candidates in February exam. So what happens was that there was I kept a station on the male factor infertility. Okay. And one of my very dear candidates, she she just started speaking on the basis of template, whatever she had in her mind. Okay. Although that station was completely the different than that station, but she took that station the other way around. She thought that this is the same station what has been the given in the set template, or what has been in the earlier exam. Okay, so she started. So by then, when I prompted her that, look, sweetheart, that you are taking this station in a wrong direction, so can you please come back again? I gave her clues to come back as an the role player. So then she came back, and then she said, oh my god, I have lost my 4 to 5 minutes. So that's why I'm telling you that don't fix in your mind that this station is going to be like this. If it is male factor infertility, it is going to be like this. If it is OHSS, this is the exactly what I have studied or what I have read with that partner, or somewhere here and there. All right. So please read question carefully, so at least you are not going to miss your the important points in your exam. And yes, it is, I agree with Humaira that we hardly get the time to even jot down. So what I think is that in that the precious 2 minutes, all you have to do is that you have to be focused. You have to be reading the question, because sometimes it takes time to come back from the previous station one. Okay, it doesn't matter that if it went good, if it went bad, of course you have to perform in the next station again. So yes, this is a human nature that we do take the few seconds to gather us up. So of course you will take few seconds to gather yourself up, and then you will start with your new station. So read question carefully, because in every station you have to be talking about, can we write? Yes, you can write, sweetheart. You can write in this column, but what you will write? this is what I'm telling you, that what you will write in that 2 minutes time. Exactly. Even if because everything will be visible in front of you. What exactly do you want to write? If you really want to write, you can write in this column. Okay, you can write in this column. So this is your column. Okay. So I believe that rather than writing and wasting time, it's better to focus on the question, and then make yourself clear that how you are going to start the session and how you are going to behave. So like, I mean, exam, because it is exam. So the in which we are going to be tested on domains. Domains are very much important, and this is very much important to understand when we are going to read for the 2 minutes time. Okay. Information gathering is the history. This is, we are so well versed with taking history, we do take on daily basis. All right. So this is the same information gathering or taking history. Then there is going to be communication with patient and relatives, the second domain. The third domain is going to be communication with colleagues. The fourth domain is going to be the applied clinical knowledge and patient safety. So moreover, you are going to be tested not on all five domains in one station, but of course, you should be knowing that, what exactly the patient safety is. Is there any, the particular patient safety in this station? Whenever you study for your exam, always think of this thing, because patient safety is prime importance in every station. For example, let me give you a famous example, that this is a case of OHSS, and we know in OHSS we don't have to give NSAIDs, right? So if somebody missed that NSAID, so it means that you are missing the patient safety, biggest patient safety. For example, this is a case of hyperemesis, and we know that in hyperemesis we don't have to give 5% dextrose. Yeah, we don't have to give dextrose, sugar, the drips. So of course, if we miss that, that's going to be very bad for us. All right, it means that we are missing that patient safety. Applied clinical knowledge, again, this is very much important. That, how you are going to talk about, the applied clinical knowledge. And I will be talking for, the all domains one by one. Let's just first speak about that, how to succeed in part 3. This is very much important, isn't it? We all want to, be successful in this exam, but how? This is very much important. You have to look confident. You have to appear as a safe doctor. You have to be logical and organized. Logical and organized mean, remember everybody that, whenever you are taking any history, sometimes you have to justify that, why I am asking this point. When you are talking about management, then you have to justify yourself as well, that, why I am, talking about this management point. In terms of, the structure discussion, yes, justification is very much important. And I will be telling you with the help of example, the later on. You have to be sympathetic and empathetic as well, but don't cry if role player starts crying. Okay, usually we don't do. Yes, we do feel bad, and this is a human nature. And plus, we do deal with OBGY, and OBGY is a very sensitive field. Although, many of the, in fact, the almost whole world don't consider OBGY as a good field. But yes, this is a very sensitive field, and we all are, the human beings as well. We do feel pain. We do, because we are dealing with two lives. So sometimes, we do get, very emotional at times. But in the real exam, we don't have to show those emotions. We can be sympathetic. We can show through our expressions. We can show our emotions. We can show our body postures. We can show our, any of our body language. But don't start crying. Don't bring tears into your own eyes. Okay, you have to be patient, and you have to be an active listener. This is I think this is the major essence of part 3, because like I said that, everything is fixed in our heads. So what happens is that we just want to utter those, the set things from our head. We are not listening to what exactly the role player is, telling us, what exactly the examiner is asking us. So unless we be a good listener and active listener, we can't be a good, the exam candidate. Trust me and mark my words. Because this way, sometimes what happens is that if we are going here and there, the role player is going to help us. He is going to give us cues. Okay. So we have to pick those, the cues as well. We have to pick those things that, what exactly she or he is guiding us through. This is very much important. Be patient, listen to the the role player, unless you think that the role player is going here and there and she or he is telling so many things. For example, she has so many complaints. So in that case, you can just interrupt politely, and then you can say that, Mrs. Tracy, I understand that you are having a lot of problems, but can I just ask you that what exactly is bothering you at the moment, or which of the following complaints are you here for? Okay, which one is the more bothersome? So this is how you are going to concise your own history. You are going to bring role player to your point. All right, so even I mean, in that you have to be very the kind of polite. So you have to use the simple understandable language in very polite tone. And by saying this, understand the understandable language and the simple languages, that you don't have to be using multiple the jargons, the medical terminologies. The role players are actors. They're not even the medical candidates, of course. So they are just going to behave whatever you are going to tell them. So use patient friendly language. And for these patient friendly language, we have got beautiful patient information leaflets. And all those patient information leaflets are based on the guidelines. What do we have? Okay, so then you have to change your character, and you have to be embedded in the role of a doctor in any specialty at the time of station. Like, I mean, in one station you are going to be the infertility specialist, in the next station you are going to be the urogynecology specialist or the urogynecology ward, in the next station you are going to cover the labor ward as well. So of course you have to change your character, and this is very much important. This is called situational awareness, that you have to be aware that where exactly are you at the moment. If you are in infertility clinic, you have to say that I am a senior doctor in the infertility clinic. If you are in urogynecology clinic, then you have to say. Then in situational awareness, another thing comes that sometimes they do give you these kind of scenarios where they really want to check the communication with colleagues, in terms of they are going to give you that you are covering this OPD or this clinic with your consultant has been called away, and now you are going to see this on behalf of your consultant. So in that case, you have to apologize to the role player or the patient. You can say that I understand that you are here to see my consultant, but my consultant has been called away, so is it okay that if I proceed with the consultation? Okay, so this is how you are going to be, like, I mean, aware of the situation you are in at the moment. So this is very much important. Then comes reason to fail exam. Very, very important and crucial things, because reason to fail exam, I think, is much more important than passing the exam. Because if you don't have persistent and consistent daily practice, so certainly you are going to lose your momentum. You are going to lose your the kind of pace for this exam. Sometimes you believe the myth that knowledge will not be tested. This is just communication skills, and trust me, I do see people struggling with the structured discussion task, because everybody is trying to gather, everybody is trying to just cram up on the communication skills. Yes, communication skill is important, as well as structured discussion is also important equally. Okay, sometimes the candidates think that this is just a pure knowledge test, or this is just communication skills. So what I'll be doing is that I will be copying the somebody, I will be just memorizing all these templates or something, and then I'm good to go. But what will happen that sometimes you may lose so many things. If you are using too many jargons, you are not using patient friendly language. Okay, because RCOG has given us a very the good the kind of things on all these medical jargons. For example, that for the uterus you have to say womb. Okay, for cervix you have to say neck of the womb. All right, so like this there are so many patient friendly the kind of phrases. So just go to the RCOG website and just look for that. That is very much important. Plus, do try to read patient information leaflet as well. This is very much important. That if you are just relying on courses or the material gathered from here and there, I have been through this, the same hassle. I have been exam candidate as well. Yes, we do help our, the fellow colleagues. We do help our friends as well. And sometimes, what people do is that, they do try to make, the some kind of strategy that, okay, one of the friend will take that course, one of the friend will take that course, and then they are going to exchange the material. But what will happen by the end? You are just gathering the material. You are just after the material. You are just after the templates. So what you are doing exactly? Of course, we all are working, and I'm sure you guys are working as well. So with and many of you guys are the I mean, apart from the clinical work, many of you are moms as well. So, with household responsibility, with kids, with, the job responsibility. So isn't it, the kind of very cumbersome that, you are just going to, gather the whole material and the courses. So what will happen is by the end of the day, you won't be even able to practice a single station in a very good, effective way. Okay. Plus, major reason is another major reason is, I must say, not believing in yourself, lack of confidence, and sometimes overconfidence as well. Lack of confidence is that I cannot do this because my English is not good. I cannot do this because, that particular person is, the more good than me. Or maybe the overconfidence. I can do it, this is nothing because my English is so good and I can just go and I can just ace this exam. This is nothing. This is just a piece of cake for me. Believe me, both these things are very dangerous. I mean, not only for exam, but for in real life as well. Trust me. If somebody who is very much overconfident, if somebody who is having underconfident as well, I mean, apart from this exam thing, trust me, this is very dangerous. And personally, I believe overconfidence, this is much more dangerous than being, the underconfident. Because overconfident person is trying to give harm to others as well. But underconfident will definitely think twice to give, the harm to herself or himself and to others as well. Okay. So basically for this exam, this is very much important that you have to believe on yourself first of all. Okay. You just have to think few things. And I have, a very good example. One of my very dear candidates, she's here at the moment. And we have been talking yesterday and she just asked me that, ma'am, can I do this exam in just 2 to 3 months? I just said to her that, look, that if you can give 10 to 12 hours, the practice, and if you just, follow, I don't, say that I'm 100%, but at least I can guide in an effective way. And she followed my advice and she immediately booked her exam. And really, I feel now this is my responsibility that I am going to teach her in an effective way. That at least, she has, relied on my advice. So of course I'm going to give her, the sincere and of course, out of the way help as well, that at least, she can prepare well. So she will be a good confident, the candidate. She has a very good knowledge. She is very fluent in her English communication skills. So all she needs is good guidance. So what are mentors for? Mentors can just guide you. All you have to do is you have to do the work hard work, and smart work as well. Smart work, like if somebody is guiding you through. Okay. So don't believe that, if you are taking so many courses or so many material, if you are gathering, because material needs, the kind of time as well, that you have to go through videos, you have to go through, the whole material. So I think, by the end you are just losing time and your, the strength as well. Because all the time, if you are just focusing on online, by the end of the day you will get headache, you will be exhausted, you will have backache as well, you will have so many, the issues too. So I mean, keep this thing in your mind as well, that, it should be targeted, it should be focused, your study. And it shouldn't be like, I mean, relying on so many things, gathered from here and there. All you have to do is that, you have to do the targeted studies. You should be knowing your syllabus, you should be knowing that, from where you have to study and how you have to start. And, one or two courses or one or two, the sincere guidance is enough, I think. This is more than enough. By that, the time when I was preparing, of course there were not so many, the courses, or there was not a kind of trend of so many things, and people were not so easily approachable as well. So we really had a hard time. But I think in this era, from 2020 onwards, I think everybody has got, very easy access to so many things. There are, the very good mentors working, in a very good proper way. So all you have to do is that you have to choose your mentor wisely as well, and just go on, just move move on with your studies. All you have to do is, the kind of guidance. That's it. So um, then in terms of this, the part 3, we think of, this is going to be a combination of knowledge blended with communication skills. Like I said earlier, that, if somebody is fluent in English, so this is not only going to help. If somebody is very good in the, the applied clinical knowledge, this is not going to help as well. You have to blend both things. Okay. Then, the words will come out, and that's going to give a good impact. Okay, so again, in terms of applied clinical knowledge, no, 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 no. People say, if you don't take course, no, trust me, this is not true at all. Okay, this is not true at all. Will come in next attempt to me. This is bad, in fact. I seriously apologize. If somebody has said it to you, Athiya, because this is really very bad, and this is not a good mentor. If somebody is telling this thing, okay, because mentor means a teacher. So a teacher has a very good responsibility. Okay, so if a true teacher is saying this thing, then I'm sorry, he or she is not a good teacher. Because, as a teacher, what we have to do is we have to uplift. Because in our class, I'm sure, I mean, all of us, one or two times, I'm so sorry. I'm so sorry that, you had to, uh, face this. But trust me, this is bad. This is bad. And I really apologize, for this thing. Because, usually, this should not be the technique. Taking the courses, yes, certainly it's going to help. Of course, whoever is working, so working hard for this, because it takes time to make, the content. It takes time to deliver the content as well. But it's not all about, the kind of money. I'm sorry. Because teacher has, the good responsibility to build a candidate, to build a confidence in the candidate. If somebody is saying that, ma'am, even today, I was speaking to somebody for part 2. So she was very upset. She said that, I feel that I'm lost. I feel that I'm depressed because I'm part of so many groups, but nobody is guiding. Everybody is saying that, like, Athiya, you just have told. So she approached to me, and this was very first time. And she's a mom as well, 3 kids, all under 5 years. So I really gave her, the kind of support. I said, look, it's not all about courses. You can always approach to me. Okay, you can talk to me. I can guide you through for part 2 as well. So this is not, I mean, a kind of this thing. But of course, this is a bad thing if somebody has said. Okay, so let's talk about domains one by one. So information gathering. So for information gathering, I need 2 volunteers as well. So if somebody will not volunteer herself or himself, I will randomly ask. Okay. So for the information gathering, this is all about history. Sometimes, this goes like this, isn't it? History, we take history, and then we do go for examination. If examination is given, or if we have to ask for examination, and then basically later on, the management will depend upon, the level of investigations as well. Okay, so in history should be very crisp. History should be structured and focused. History should be using less jargons, and it should be patient friendly as well. History means that, your language should be very easy, and, the very jargon free, and it should be patient friendly as well. So if it is not crisp, and if you're not talking, in terms of particularly about that station, and you are just talking here and there. And I remember that, me and Dr. Hassan, we both were conducting a session, the before exam, and he said a very, the important thing. This is a case of urinary incontinence, and the lady is 76 years, and everybody is bothered about that, the use of recreational drugs. Really, 75, 76-year-old, and who is here for urinary incontinence problem, and everybody is bothered about, we have conducted that station, And he really gave a very good tip about this thing, that yes, recreational drugs is very much important, but to, the cases where you really think that recreational drugs can be a part of that, the station, it can be part of that disease process, or we may have to address some things in terms of management as well. But of course, 78 years. So do you think that, 78 years old lady, until and unless that, she is habitual for something. So we really need to be bothered about, do you smoke, drink alcohol, and pardon me for asking any recreational drugs. So I don't think that, this is wise, so it should be very crisp. It should be very patient centered, and it should be very focused and structured. And even if you miss anything, and you can always come back, okay, you can always come back in terms of management. And then you can say that, oh, for example, if you forgot to ask about the drug history or the allergy history, for example, if in terms of management you're talking about, the um, um, drugs, so you can, add at that point, you can say, oh, I'm sorry, Tracy, I forgot to ask you, are you allergic to any particular medication? No? Okay, fine, because I was just going to talk about these medications. If you didn't ask about, the something which is important in your management, you can always come back. But remember, if you are missing, the important things, for example, this is a gynae case and you are missing, the cervical screening history, you are missing, the something, then of course, then you are missing, the major stuff. If you're not asking about cycles, if you're not asking about, the if your cycles are regular and normal, okay, do you ever bleed between two periods, that is intermenstrual bleeding? Are your periods regular and normal? It means that you are excluding heavy menstrual bleeding at the same time. Okay, so do you ever bleed after having sex? So that is also, the postcoital bleeding, that is also very much important. And again, don't be shy in, the saying, or you using the word, the sexual intercourse. Many people say sexual activity, many people say, the intercourse or the sexual intercourse. You can simply say sex as well. We are talking about, the European country, we are talking about UK, we are talking about Ireland. Okay, we are not talking about, the R countries where we really think that this is going to be a taboo, that if we just utter this word, that, having sex or having sexually active is like, kind of bad. Don't be shy in asking these questions. Okay, so you can simply ask. So don't give, the many signposting that, can I ask you some question? I asked this question from so many, of my all of my patients, because this is really going to help me, that, and then you are going to ask that, are you sexually active? How many partners do you have? Okay, like this. Why you have to signpost? Do you really think that this is bad? Why you have to signpost if you are asking for somebody for smoking, for, the alcohol, for even recreational drugs? Do you think smoking is bad, or smoking is kind of, where you have to signpost? Yes or no? Hmm? Smoking, do you have to signpost for, if you have to ask for smoking? Do you have to signpost for alcohol as well? Yes, yes, very good. We don't have to, signpost, of course. Smoking is very normal. And even in our countries these days, it is very normal. So why do we have to signpost for everything, that, pardon me asking that, do you smoke? Pardon me asking that, do you take alcohol? Pardon me asking that, do you take any recreational drugs? Oh my God. Why sorry? Why are you sorry? Akhi, why are you sorry? Have you done something wrong? When do you say sorry? When do you say sorry? If you have done something wrong, then of course you say that, I'm so sorry that I have done this thing to you. I'm so sorry that, I have been bad to you. I'm so sorry that I have been rude to you. Of course. Okay. Yeah. So of course, when you have to, so you can simply ask. And Dr. Hassan, very, very beautifully say that, you can simply even ask that, can I ask about your social habits? Do you ever smoke, drink, or, take any recreational drugs? And the phrase what I use usually is that, do you smoke, drink, or do any recreational drugs? So that's it. Why pardon me asking smoking, pardon me asking this thing, pardon me asking this thing, blah, blah, blah. Do you think that it is really going to help you? Or is it going to cost you your precious 30 seconds or 40 seconds? which you can use in your management, isn't it? So don't give so many signposting for so many things until and unless you really think that you have to signpost for something. So your history should be crisp. It should be very structured and focused. Focused mean only relative to that particular station. It should be very patient friendly. Okay, so now I need the volunteers as well after a few slides. So be prepared. So you have to approach to the patient in a very calm manner, and you should look confident. So it should be like, patient from, if it is like, clinical exam. So of course, we do approach from right side. We have to greet patient. You have to introduce yourself. We have to take consent as well that, I'm going to ask you two questions. Like, is it okay to you? In which question we need to signpost? If you really think that, that this is a case of, you can say the sexual abuse, rape. Okay. Yes, I did. Yes, I did, Jeet. If I'm not wrong, you're Jeet Kaur. So good to see you. Yes, I scored 86%. I failed with 2%. When I failed with 2%, the pass marks were 62. I scored 60%. Okay. When I passed with 86%. Alhamdulillah. Okay. So of course, bad patches come in life. So it doesn't mean that we are going to stay there, or we are just going to mourn on that thing. Okay. Yeah. Thank you. So let me come back to the signposting, Atya. Um, so yes, if it is a rape case, if you think that this is a kind of where there is involvement of so many things, for example, the abuse, the drug abuse, and then you have to, if it is same sex relationship, if it is a kind of where you think that the patient can be exposed to multiple sexually shared infection. Okay, so of course in that case you have to signpost. So you can't be so blunt. You can't just ask that, can I know that how many sex partners do you have? So of course we can't ask. All right, we have to be very polite in our language, even in even in our real life as well. We have to be using very the good words, good language. All right, so this is how we have to speak. So in that case, if you have to ask, so of course you are going to ask in, like, don't mind me asking, can I ask you that this is not, so in that case you can even say one beautiful thing as well. I don't want to be judgmental, but can I ask you that how many sex partners do you have? So I don't want to be so in that case you can say okay, in that case you can do something, be to be nice and look nice as well. Of course you can't be rude to anybody and to asking in a direct way that how many sex partners do you have, how are you sexually active at the moment. And for sexually active as well, you can ask in a very polite way. And of course this is a simple English. This is not something that if somebody is going to teach you, you can simply ask, are you with someone at the moment? Are you seeing somebody at the moment? Signpost mean that where you think that this is going to hurt somebody, or this is going to hurt somebody's feeling. Okay, or where you think that somebody will feel bad. Mona, that is signpost. Clear? Okay, so then you will be asking about you have to greet patient. Okay, so you have to greet patient, or if it is examiner structured discussion, you have to greet examiner as well. So this what I do usually. So I always greet, I always say that, hello, good morning, I'm Dr. Qureshi, one of the exam candidate. Okay, so I gathered that from your case note that you are Mrs. Tracy and you are here to discuss your pregnancy journey and you are a case of epilepsy. Am I right? Yes, doctor. So you will introduce yourself, you will take consent. You will say that, in the, the upcoming, the 10 minutes, I'll be asking you a few couple of questions that is going to help me in managing you and your case. And then I will take you through your pregnancy journey. Is that okay with you? So this is going to be, the simple consent that you are asking somebody that, yes, okay. Yeah, permission, you can say. That is signposting. So then again, the simple, the presenting complaint, then history of presenting complaint, then that's going to be accordingly, the onset. For example, if it is pain, if it is bleeding, if it is something, You will ask about onset, duration of symptom. Is there any, the aggravating factor, relieving factor, association with any, the differential diagnosis where you have to do. Then you will ask about, the simple past medical history, past surgical history. Okay, yes. For this, I want to address one thing. For example, this is the case of epilepsy. So of course, in the family history, you will be very specific in asking about that, any family history of epilepsy, okay, or any other medical illness. In this, what candidate do is they are not going to be specific. They're just going to ask, can I ask that, is there any family history of clots in legs and lungs? Yes, that is important. But what exactly do you need in epilepsy? What exactly do you need to know in any hypertensive disease? What exactly do you need to know in phenylketonuria disease or any other disease? Of course, if it is any genetic disease. So yes, you need to be asking about genetic, the diseases as well. In terms of past surgical history, this is not past surgical history on the head or on the abdomen or upper limb surgery. You have to be very specific that, any surgery on in your lower tummy or down below. That's it. Simple. If you really want to be specific, then you can simply ask. Then family history of concern, past medical history of the same. Okay. So for example, if it is epilepsy case, so of course you are going to ask for the past medical history that, do you see your GP other than this epilepsy for any medical illness? Or simply you can say that, do you have any other medical issues other than that? There are so many, the simple phrases. So any of the phrase you can use. This is all up to you. And this is again not the template. This is just how we communicate. Okay. So family history again, gynecological and obstetrical history, drug history you can ask, history of allergy, it is important. Personal history in terms of, like we have said earlier, that, the history of smoking and, the drugs and the alcohol. Oh yes, for the smoking, patient is smoking 1 to 2 cigarettes. And then what candidate will say that I understand that you are smoking. I don't want to be judgmental. I will put you across with the NHS Stop Smoking Cessation Services program, and they will help you in quitting the smoking. And this way you are going to be in good health. 1 to 2 cigarettes. Yes, we know that cigarette smoking is not good for pregnant lady. Cigarette smoking is not good at all. Okay. If it is pregnancy, of course, the less than 11 cigarettes is going to be the minor risk factor for small for gestational age. If it is more than 11 cigarettes, then it's going to be, the major risk factor of small for gestational age, plus, the many things as well. You can simply ask for surgeries as well. Okay. If she's telling you, if you want to ask about splenectomy, yes, you have to be specific in that. For example, I'm sure if you are asking in the context of thalassemia. So yes, you have to ask, is there any history of, the surgery on the removal of spleen? Because spleen is spleen. Okay. So in that context, you can ask simply. All right. So I was talking about smoking. 1 to 2 cigarette is okay. 1 to 2 cigarette can be, stopped on simple, the kind of, if you do the counseling. So you can just tell her that, it is very much, the good idea to stop the smoking, because generally smoking is not good for health. But if the woman is smoking 11 to 20 cigarettes a day, then yes, you have to put her across with NHS Stop Smoking Cessation Services program. Because this needs help. Because now she needs help. By this, what you will do is that, you are overburdening your, the fellow department. Because NHS Stop Smoking Cessation is a service where many of the, the volunteers are going to work for, to help the women and, the people who are smoking. But if it is, the 11 to 20 cigarettes, then put her in touch, but not with 1 to 2 cigarette only. You can simply say, and if she thinks that she needs help, so yes, then you can put her in touch with the NHS. And likewise for the alcohol as well. If she's, the taking alcohol very oftenly on the weekends or parties, I don't think that, we have to put them with any, the alcohol stop, the services too or something. But if somebody is having, the alcohol on daily basis and it is heavy drinking, so yes, she needs help, because we know that alcohol itself is not good for pregnancy, for upcoming baby and all. Mental health question is very much important because of, the raise in the mental health issues all around the globe. So it is very much important that you have to the acquire about the mental health, that how have you been feeling for the last 4 weeks? Have you been bothered by being, the low depressive mood in the last 4 weeks? Because these are going to be the Woolies screening question. If any of the answer is yes, then of course you have to screen for the major, the Woolies criteria, then there's going to be the questionnaire, complete PHQ questionnaire or anything, the anxiety questionnaire, GAD 7 score or something. So this is going to be the basic concept. But if at all you are missing something, so don't worry, okay? Don't show it from your face that you have missed something from history. You can always catch up. For like I have given you example that if you have missed anything in the drug or in terms of allergies, then you can come back again. You can just talk simply that I'm sorry, I forgot to ask you that, are you allergic to any particular medications? So I mean, this way you can fulfill your patient safety at that time. But don't bother and don't worry if you have missed anything. So the sources to use for the easy language: NHS choices, patient information leaflets, very much important, RCOG leaflets. Do watch the YouTube videos, Vimeo channel for the RCOG. It has very beautiful templates, so you can always watch. Okay, so Vimeo channel, Vimeo is an app, okay, and RCOG has got a channel on the Vimeo. You can always log in, you can make your own account, okay, you can save videos, you can watch videos later as well. YouTube certainly helps in so many things, okay? So watch YouTube videos for simple communication skills, not only the RCOG, but you can take help from PLAB aspirants as well. You can take help from USMLE PACES as well. You can take help from, even the this MRCP medicine candidates as well. You can go through so many things. So this is how I have improved on myself, okay, in terms of communication, that I do try to watch, whenever I get time, the new videos, anything. And it's not always that MRCOG channel or something, okay? You can always take help for the communication for any random videos, okay? USMLE paces, then, the anything, you can go for that. Okay. So I need a volunteer that who is going to take a focused history for this case. Anyone? Anyone who's going to volunteer? Just give me idea that what exactly you are going to ask in this history. Okay, Tanya. Yes. Read this question and then just tell me that what exactly you are going to ask from this patient. How you are going to introduce yourself.
Yes, ma'am.
Yes.
Hello, I am Dr. Tania, one of the doctor of the antenatal clinic today. May I confirm your name and age, please?
Yes, I'm Amanda Thomas and I'm 25 years.
Okay, how can I address you?
Amanda is fine, doctor.
Okay, Amanda, from your history, yeah, I have seen that this is your first pregnancy,
Yes,
and
yes,
you have a condition that is epilepsy, and you are taking some anti-epileptic medication, and now you are concerned about your pregnancy and upcoming baby. Am I right?
Yes, yes, doctor. Absolutely.
Okay. Amanda, in the next few minutes, I would like to ask you some relevant questions to know more about you so that we can make an effective management plan for you. Is that okay for you?
Yes, doctor. Thank you.
Okay. Amanda, would you please tell me, this is your first pregnancy. What about your last menstrual period?
It was 8 weeks ago, doctor.
Okay. Was it a planned pregnancy?
Yes, it was.
Okay. And then, Amanda, tell me, are you taking any contraceptive method before this pregnancy?
No, doctor. Actually, me and my partner, we both have been planning to become pregnant. So, I was not using any, but earlier we used to do these condoms. So, I left these condoms for like, 6 months, and then, I became pregnant. That's it.
Okay. Amanda, what about your feet control for last 1 year?
I had my, the last fit for about 9 months ago.
Yeah. And when you last visit your doctor?
6 months ago, doctor.
6 months ago. What medication are you taking for that, for
Yes,
controlling your feet?
yes, doctor. I am taking valproic acid, and I am taking carbamazepine as well. So, I have been through on internet, and I have seen that, there are so many, the side effects on the baby for these drugs. So I'm very much worried that what exactly will happen, that, now I'm pregnant, and, what will happen to me and my baby and my pregnancy as well.
Okay. So Amanda, are you taking this medication till now?
Yes, doctor. Actually, I was about to come early, but somehow, I couldn't come to the hospital. But now I'm very much worried that what will happen.
Okay. Um, you were right, Amanda, that some anti-epileptic medication are harmful for your upcoming baby. And as you are taking sodium valproate, we are concerned about that medication because that causes some anomaly in the baby.
Mm-hmm.
That means the baby is in risk. So we have to switch this drug to another safe medication.
Mm-hmm. Okay, fine.
So you will be managed by a team of doctors by involving senior obstetrician who is
Mm-hmm.
expert in this um, uh, medicine. This which in and we will involve the neurologist,
Mm-hmm.
and then we will plan your safety medicine actually, and we will try to control your fit because in pregnancy the chance there is some impact of epilepsy on pregnancy and some effect of pregnancy on epilepsy.
Mm-hmm. Okay, fine.
So safe medication is mandatory, and very quickly we will uh, switch your medication.
Mm-hmm.
Okay,
Okay, all
and
right.
lemotixin is a safe medication and very nice to control the fits. So
Mm-hmm.
we will decide in the next appointment. Very
Mm-hmm.
soon we will decide to shift this medication,
Mm-hmm.
and at the same time you will be given high dose folic acid.
Mm-hmm. Okay,
That
fine.
means 5 milligram every
Okay.
day. Okay?
Okay, Tanya, stop. So we are not talking about management, sweetheart. Okay. So in terms of history, do you think you have asked everything for
No, no,
epilepsy?
no. I have to ask more things, ma'am.
Okay, okay. So no problem. Okay. So if I ask you that, now that, don't ask me anything, that what exactly will you ask in epilepsy history from patient? If somebody is coming, she is a known case. See, what is the information given to you? You took a lot of time to set your agenda. Okay, you said that I understand that this is your first pregnancy and you are having a condition what is called as epilepsy, and now you are here to discuss about, and you are taking some anti-epileptic medications as well, and now you are concerned about. See, sweetheart, you don't have to rephrase or paraphrase the question at all. Okay, what you have to
Okay.
do is that you have to pick that. Can I cross check your name and age, please? Yes, I'm Amanda Thomas and I'm 25 years. Can I call you Amanda? Yes, doctor. Okay. So, Amanda, that you are here to discuss about epilepsy and the pregnancy care plan. Am I right? Yes, doctor. So, can you please tell me that I understand that you are having this epilepsy for about 13 years of age? Am I right? Because you have to, you know? reconfirm whatever information is given to you. So you have to reconfirm. You're not going to completely, summarize or completely utter the same question to patient. No, she's here. Okay. She is concerned about her pregnancy and upcoming baby. She has read a lot on Google about the effects of these drugs. All right. So in terms of this, you will say that I understand that, you are having so many concerns about the anti-epileptic drugs and all. So in the next few minutes I'll be talking to you about this, that how your pregnancy is going to be cared for, and what is going to be the effect of medications you are taking. So before that, is it okay that I ask you a couple of questions just to know more about you? Yes, yes, doctor. Okay. So, Amanda, you said that you are having this epilepsy for last 13 years. So, can you please tell me that, what is the frequency of fits? How oftenly you do get fits? Uh-huh. And do you know that what exactly the type of epilepsy is it? Because according to guideline, sudden unexpected death of epilepsy is going to be with generalized epileptic fits. So you have to be very careful, because in the last 2 MB race report, SUDEP has been addressed. Okay, very beautifully. SUDEP has been addressed again and again. All right. So you will simply ask like this. Okay. All right. All right. So in that, then you will hum. Okay. You will do some kind of humming. You will be saying that, okay, all right. Uh-huh. I see. So you will be talking about so, and you said that it is a generalized epilepsy. All right. And when was your last visit with your doctor? 6 months ago. All right. And when you had your last fit? Okay. All right. So then now you have made everything in your mind that she had a last fit 9 months ago. She has visited her doctor 6 months ago. This is a planned pregnancy. If it is a planned pregnancy, so I don't think it's a wise idea that you will be talking about contraception. If it is a planned pregnancy, then of course she had to stop contraception and then she had to plan for it. Okay. If it is a planned pregnancy, for every medical disorder, everybody please, for every medical disorder, we know that we have got preconception counseling as well. So if it is a planned pregnancy, your next question should be, all right, I see. So I mean, did you see your doctor before getting pregnant or before embarking on pregnancy? All right. So does your doctor know that you're pregnant now? Uh-huh. All right. And you said that you had your last fit 9 months ago. And is there any history of hospitalization because of fits or something? Or have you ever been to hospitalized? Or have you ever been to any hospital because of this epilepsy? Any, the phrase you can use. All right. And apart from this epilepsy, do you have any other medical condition? Any medical problem? Personally, I don't use condition, because condition is what condition? These are medical disorders. These are problems, medical, the kind of diseases. Condition is which will come, and I mean, I think which will go away, the condition. So I think personally, I don't use condition sometimes, because everybody is using, you are having this condition, you are having this problem. So I think we can simply ask for epilepsy. We can simply ask if it is a case of the diabetes, if it is a case of hypertension. We can simply say that you are having hypertension for last 13 years. You are having diabetes for the last 2 years. Am I right? So simply, that is simple. That is very, the okay to ask like this. Then, for epilepsy, now you know that, you have your enough information, because then you have to bring your guideline knowledge. That if somebody is pregnant, applied clinical knowledge, she is having grand mal epilepsy or generalized tonic-clonic seizure. Okay. She had last fit 9 months ago. It means now you, in terms of management, now you have to address this, because this is going to put you at being high risk in having fits again, because usually we do consider them at high risk if somebody is having fits in the last, the 1 year before getting pregnant. So you have to address that. And apart from that, because you have asked about medical issues, then surgery you will address, and then you will ask about that, do you ever smoke, drink, or do any recreational drugs? No. All right, that's good. And apart from this epilepsy, you have told me that you don't have any medical condition, and any surgery on your tummy or down below? No. Are you allergic to any medications? All right. And can you please tell me that, is there any family history of epilepsy or any other medical condition? No. All right. Fine. And what do you do for living? Okay. And house support, whom do you live with? The partner. And do you think that, he's a good support to you? Or do you feel yourself a happy couple? Mm-hmm. Yes, yes. Okay, fine. That's good. That's good. All right. And don't ask about support system. Many candidates use, how is your support system? System is system. So we can't say that somebody is having any support system. System means which is going to involve so many people. We can simply ask about that. How support at home, is everything okay at home, or if she is living with her partner or husband. So you can simply ask, do you feel yourself a happy couple? Do you feel, if there is any element of the abuse or something, then you can add any other the phrase as well. But since this is a very the simple case, epilepsy, she is here for pregnancy care and everything, so of course you will be just spontaneous. You will just be asking which is going to help you in your management. So now you have gathered everything, and then you will talk about the management plan. Yes, you are going to address, this is her main concern, that she's worried about anti-epileptic drugs, that it will have the problems on upcoming baby. But yes, you have to address that. So how you are going to kill that concern, that usually there are the chances of baby having some kind of problems in the the development. For example, baby can have defects in the brain, heart, spine, and the limbs as well. Okay, but for this we have to go for the detailed scan. Usually we offer it at 18 to 20 weeks of gestation. So at the moment, it is very early to say, but at the moment, the main concern is going to be to prescribe you with, the much pregnancy-friendly medication or much safer medication for you and your baby. All right. So for this, what I'll be doing is that I will take an urgent appointment with your doctor, okay, neurologist. I will involve my senior consultant, okay, and I will be taking help from, the any midwife or any if she needs any kind of help as well, so you can say something like that. All right, Tanya.
Yes, ma'am. Thank you so much, ma'am.
Do you think it is better now that you have to be very spontaneous, very the kind of very spontaneous? You don't have to set templates in your head at all.
Yes, ma'am.
Okay,
Very simple words and just
very simple
spontaneous.
words. Okay, it should be very
Yeah.
spontaneous and very the come on. Don't say brain doctor. Do you think, is there, if I ask you that I am okay, I am OBGY, so what you will call me? What you will call me, Shanti? For obstetrician and gynecologist, what you will call me? Lady doctor? In our countries, we are being termed as lady doctor, isn't it? But of course, down below doctor. Yes, that's funny. Or the doctors dealing with pregnancies. I mean, this is very funny. How people can say pain doctor, anesthesia doctor, brain doctor, heart doctor, kidney doctor. Oh, come on. We are talking to English people, okay? We are not talking to our, this normal, the people in our countries. Even in our countries, simply say neurologist. Simply say, or simply you can say the epilepsy doctor. Simply. Stay simple. Brain doctor, okay, if at all, if somebody sleep, yeah, sleep doctor, pain doctor, I mean, does it really make sense? Personally, I don't like these, the things that brain doctor, pain doctor, kidney doctor, heart doctor. I mean, it looks very some kind of weird thing. We can simply say that if at all the role player is not understanding, in that case you can say, if you are saying that I'll be talking to an anesthetist who is going to talk to you about that how we are going to pain relief in labor. Okay, so if she doesn't understand anesthetist, so in that case you can say that they are the special doctor who are going to help you with the pain relief in labor. All right, so we call them anesthetist. So I mean, I think it is good. It is good idea rather than saying that sleep doctor or pain doctor. I think I personally I think this is not good. But everybody has their own style. But personally, I don't think that this is good. Uh-huh. Okay. So is there any question from epilepsy in terms of history? See, again, I will say that you have to be spontaneous. You have to be like, I mean, very flowy in your conversation. You shouldn't be making a template in your head that, I have to ask this, I have to ask this, and I have to ask this. First, finish your related history and then, come to the management. Clear, everyone? Okay. So no question is a good question as well. So I will take it as a good thing that it is clear to everybody. Okay. So I need another volunteer. Palvisha?
Yes, I'm here.
Okay, fine. So can you take history for this as well?
Yeah, sure. Let me read the instructions quickly.
Mhm.
Hi, my name is Dr. Iftikhar. I'm one of the doctor in clinic today. May I confirm your name and age, please?
Yes, I'm Amanda Thomas and I'm 26 years.
Can I call you Amanda?
Yes, doctor.
How are you doing, Amanda?
Yeah, I'm doing fine, doctor. But I just had this, the scan, and I'm really concerned about that because, the doctor who did ultrasound on me, she was very worried and concerned. So I really want to know that what exactly is in this scan, because this is my first pregnancy and I'm very much anxious.
Okay. Amanda, I understand your concerns. So what we will be doing in this consult, I'll be asking you some questions. Then we will discuss your management plan and also we'll discuss your ultrasound report. But if you have any questions and concerns, you can interrupt me anytime, okay?
Oh yeah, sure, doctor. Thank you.
Thank you. So Amanda, can you tell me like if it's a planned pregnancy or unplanned?
Basically, doctor, it's an unplanned pregnancy, but I'm very happy to continue.
Okay. And when was your last menstrual period?
It was for about, I think, 3.5 months ago.
Okay. And can you tell me more about this pregnancy? Like how it's going?
Yeah, so far it is good. Initially, I had some kind of, the vomitings, and I just felt like throwing up whatever I was taking. But now it got settled down a bit, and I think now I'm moving forward with this pregnancy.
Okay. Also, any fevers or anything during this pregnancy?
No, doctor, not at all. Not I can
Yeah.
recall of. Yeah.
Okay. Okay. And is this have you ever got pregnant before?
No, doctor, this is my first pregnancy.
This is your first pregnancy.
Yeah.
Okay. Okay. Anything else you would like to add related to this pregnancy? Were you taking folic acid or anything?
No, doctor, not as such. I was just taking, the folic acid what midwife has given me, and that's it.
So did you start it before pregnancy or you were taking it, you started it once your pregnancy was confirmed?
In pregnancy, that's it.
Oh, okay, okay. And have you got pregnant before?
No, doctor.
Okay, okay. And any sexually transmitted diseases in the past?
No, not I can recall of. No.
Okay, and are you up to date with your smears?
I had one and it was normal.
Okay. Any medical disorder that runs in your family or any baby anomalies in your family?
No, doctor.
Okay. Any medical disorder for which you see as a GP?
No, I'm generally fit and well. No issue
Okay.
at all. Yeah.
Okay. Any surgeries on your tummy down below?
No, doctor.
Okay. And do you drink or smoke?
Just like oftenly, not on regular basis.
Or use any recreational drugs?
No, doctor, not at all.
Any allergies, drug allergy or any other allergy?
Yes, I'm allergic to penicillin.
Penicillin. Okay. And have you ever used any medication for a prolonged period of time?
No, doctor.
Okay. And what about okay. And who do you live with?
Yeah, my partner.
Is he supportive?
Yes, very much.
Okay. And what do you do for a living?
Yeah, I work as a secretary in an office.
Okay. Okay, that's great. Okay. And have you been feeling low or depressed in the last couple of weeks or months?
Yeah, it's not like low or depressed. I'm just anxious because this is my first pregnancy and I just had a scan. So at the moment, I'm very much worried what exactly is in the scan. That's it.
Yeah, we will be discussing with you about the scan. Yeah. So, do you want to accompany someone or your partner?
Why, doctor? Is there something wrong?
So I don't have good news for you. So, if you want to accompany someone,
I'm sorry, I didn't get it. What kind of good, I mean, bad news or something? What exactly? Is
so
it something with my baby?
we have to discuss your ultrasound report. If you want to
Uh-huh.
accompany someone like your partner, we can schedule your next visit or whatever is
No,
convenient for
no,
you.
doctor. I'm okay because I took off from my work and I really want to discuss it today.
Yeah, so Miss Amanda, I can see that the baby in the ultrasound scan, the baby head is not formed properly. So with this condition, it's difficult to continue a pregnancy and have a normal baby.
No, doctor. Come again, please. I didn't get it. What do you mean by, the baby's brain is not, the developed? I mean, is it bad? Is it something, which is not normal?
I'm so sorry that I have this difficult news for you, but yes, we have done the scan, and the baby's brain is not developed in the scan.
Mhm.
So it is not advisable to continue the pregnancy, because continuing this pregnancy, um, uh, you cannot do that, because the baby this is the condition baby cannot live with.
Mhm. Okay. Okay. So stop because we are not talking about management at the
Yeah,
moment.
yeah, I just started it,
So
but I know I did it till the
no
mental
problem.
health
No
part. Yeah,
problem.
then I just started talking about just discussing the report.
Exactly.
Yeah.
Okay, no problem. So what do you think about, the anencephaly? What are the causes of anencephaly, sweetheart? What
They
exactly you have to focus on in the anencephaly patient?
So I was thinking about infections. Could be any infection, torch infections, or could be because of folic acid.
Yes, folic acid. If you're talking about folic acid, the next question should be the dose of folic acid. What dose is
Okay.
she on? Okay. So next question should be this, because we know that the folic acid deficiency will lead to neural tube defects. Family history of neural tube defects will lead to neural tube defects. If the person is having long lasting diabetes mellitus, so you have to be very specific in asking this question as well. Okay, that
Yeah.
because it can lead to neural tube defects as well. And this is the major congenital anomaly in the CNS that can be picked in the early scan.
Yeah.
Okay,
So that's why I was just
exactly. Okay,
asking
so
about if she started taking before pregnancy or during pregnancy, but I missed the dose.
yes, and if it is unplanned pregnancy, so how come she can start before pregnancy as well? So we have to be thinking of that. We have to
Okay,
be
sure,
thinking for that too. Okay,
sure. Thank you.
so and then the cocaine, it was good, but the cocaine can also be having the small part in development of the some of the defects, but sometimes not always. Okay, so
Okay.
recreational drugs is justifiable in this question. So you have asked, that was very good. But moreover, when we talk about the history, again, I will say that our history should focus on, the important stuff. For
Okay.
example, this is an encephaly, so we should be knowing the causes of an encephaly. Yes, it is moreover, it is kind of no cause, but in the known causes, it is the lack of folic acid deficiency, family history of neural tube defects, and diabetes mellitus, long lasting, personal history of neural tube defects as well. So you have to address that. When it comes to folic acid, you will talk about the dose of the folic acid, because it is unplanned pregnancy. So yes, we have to give her high dose folic acid in the next pregnancy, but not in this pregnancy, of course, because in this pregnancy we will be talking about termination of pregnancy later on. Okay, in terms of history, if somebody is telling you that I'm having this penicillin allergy, or the metronidazole allergy or anything, so at the same time your next sentence should be that, okay, so I will write it down in your case notes as well.
Okay.
Everybody will
Okay.
know that you are penicillin allergic. Okay.
Okay.
So
Okay.
but many candidates do this mistake as well, that they will talk about the allergic reaction at the same time. Can you please tell me, what do you get when you get this penicillin injection? Come on, we are not giving her penicillin injection at the moment. We are talking about an encephaly or any management. You will
Yeah.
just simply say that I will write down in your case notes as well. Okay.
Yeah.
So it
Yeah.
is important. Rest, I think you are good. Okay. But again, because for every condition, our history should be very specific. If you are
Yes.
talking about family history, then you have to specifically ask about that, not about the anomalies simply. You will simply ask about that. Is there any family history of, the congenital or the birth defects? Anomalies is again a jargon.
And jargon. Okay.
Jargon,
Got it.
okay.
Thank
So
you. Thank you.
you will be asking about that. Is there any family history of genetic diseases, or is there any family history of congenital problems, or is there any family history of the birth defects or something? So
Okay.
then she will be alarmed that, okay, there is something that that why. She will ask you that, why, doctor? So then you will say that, because I needed to know in your case at the moment. Okay. So then you can just address in this way.
Yeah.
Penicillin, yes, and moreover, anencephaly is not brain defect in the brain development. It is the cap,
Yeah. Yeah.
the skull cap, which
Yeah.
is not developed. So no problem. We will do this station in our course. So don't worry about it. So the idea of bringing these two stations was that how we are going to introduce ourselves, how we are going to take the focus history, because again our history should be very focused and targeted. If our history is not targeted and focused, so what we can do is that we can miss so many things in anencephaly management, because when
Yes.
it comes to the management, of course, then you have to first of all break the news. Okay, you will. Okay, in terms of break the news, again, you have to say that I don't have very good news to tell you at the moment, Amanda. I have your scan with me, and it's not very much reassuring. Do you want somebody to call in, because I'll be talking to you about a lot of things in terms of the scan, and then later on management as well. You might need some kind of support.
Yeah.
No, doctor, I'm okay. All right. So in that case, you can even call, the support nurse as well.
Yeah.
In NHS, support nurses are available too. So if she is comfortable to talk to you alone, so it is okay. I mean, don't push her. Don't, tell her again and again that no, you need some kind of support. Okay. So leave it there, and then you will talk about that, your ultrasound showed that your baby hasn't developed properly. The skull cap, the normally the brain has the skull cap by which the brain is protected, and the baby is having the genetic condition, not genetic, the developmental defect in the brain. Okay. Basically it's a defect in the skull bone, in which the cap of the skull is not developed. We call it as anencephaly. So
Mhm.
first you will tell the anencephaly, and then you will explain about the anencephaly. Okay. So if you will just quickly, doesn't matter if it is anencephaly, doesn't matter if it is gastroschisis, doesn't matter if it is any Arnold-Chiari malformation syndrome or anything, or any the disorder. So first you have to say the name, and then you will talk about in the easy language. Okay.
Okay.
So then you will be talking about that, then blah, blah, blah in terms of management, that, at the moment, this is this. So we have got these options. So you can continue pregnancy, you can terminate the pregnancy. So sooner the better. So this is how, you are going to talk in terms of management, of course. So 13 weeks, if we go for termination of pregnancy, so certainly it's going to be easy, rather than, if she continue
Yeah.
on having pregnancy, and then, and then we can, if she says that, what if I want to continue the pregnancy, you can say that, yes, decision is going to be yours, but at the moment, the termination of the pregnancy or the ending of the pregnancy there and then is going to be a good decision. Because because as I said earlier, that the skull or the cap of the brain is not developed. So what will happen is that even if you have the pregnancy, you can go on with the pregnancy. We will do multiple checks on you, we will have multiple scans, and then with this anencephaly, you may have the water around the baby that can be more than normal. There can be other problems as well with your health. And uh, then later on what can happen is that you might not go into the spontaneous labor because the cap of the skull is not there. So what will happen is that baby might not undergo into the vaginal birth, so we might have to deliver you with the help of cesarean. All right, so
Okay.
this is always going to be an a kind of the concern at the time of labor. Okay, so that's
Okay.
why. And even if the baby delivers, so there are uh, there are no chances that baby may survive. Okay, after
Okay.
even after having birth. So and then of course we are going to be talking in terms of management later on. But again, I will say that in terms of history, because we have to be very specific in terms of history, be it anencephaly or any neural tube defects. So we all know that neural tube defects are associated with the few important things: low dose folic acid, then family history, history of diabetes, and history of the personal history of the neural tube defects as well. So yes, I think that's it. So we have to be very specific. Okay.
Okay. Thank you.
Okay, great. Good. Is it clear, everyone? In terms of history, that this is in terms of history or information gathering. This is not the different than what we do in our day-to-day practice. All right, so this is no different than that. Okay, okay, all right. So this was one domain, information gathering, and usually information gathering is very much important because this is going to lead us, that how we are going to behave in our station. Okay, how we are going to proceed with our consultation. Then comes applied clinical knowledge. Again, applied clinical knowledge doesn't mean that you have to say the complete, the guideline, 80 pages guideline, 60 pages guideline. This is applied. Okay, whatever is the question, you have to apply according to whatever are the clinical aspect of that guideline to particular the station. So of course you have to revise your guideline points again, and the green top guidelines, nice guideline, TOG articles as well. So it is very much important. So this is going to be applied clinical knowledge. Communication, again, you have to be empathetic, sympathetic as well. Remember to acquire about patient's relationship with her family and relatives, plus how far they live from hospital. If you want to put them into the conservative management, for example, this is a case of placenta previa, this is a case of miscarriage in which you have asked her to go for expectant management. For example, this is a case of twin pregnancy, this is a case of OHSS or hyperemesis or anything. In that case, you are going to be asking about that: how far do you live from hospital? Okay, do you have your own transport? Do you have your own phone facility available? Because in that case, she has to come in terms of emergency. All right, then you don't show anger in response to their anger. This is a very natural phenomena that if somebody is showing anger, so we may show the anger in the response. But in real exam or even in real life as well with the patients, we can't be the angry until and unless the reason is very legit and the reason is very the kind of strong, that where we have to be angry. And of course we do get angry on the patients, for example, if they're not taking their medications on time, if they're not following up with properly, if they're not having their scans regularly. So of course but still it should be in limits. This is not our family that we are just going to react. Don't overreact to anything. Okay, plus don't be astonished if somebody is saying that I'm in same sex relationship, and then same sex, I'm having the multiple sex partners, multiple sex part. No, not at all. You're you shouldn't be showing any the expressions from your faces at all. So at all your face should be very neutral. Don't overreact to anything. If they start crying, don't start crying yourself. Listen to them. Interrupt if you think it's necessary. Plus, don't impose your decisions on them. Be neutral. For example, like in this case of anencephaly, we know that the termination of pregnancy is a wide decision, isn't it? Okay. Yeah, mask face. I mean, not mask, but it should be a bit neutral kind of face. Okay, mask is like, I mean, without any, the kind of feeling or something. Okay, it should be very neutral. You shouldn't be showing anything. You can say mask face as well. Plus, don't impose your decisions. You are not going to say that, look, this is the good decision for you, that you have to go for termination of pregnancy. No, if you don't go for termination of pregnancy, you are going to have this. No, we can say that, there can be a couple of options. The termination of pregnancy is one of those. The second is continuation of the pregnancy. Whichever decision you will take, we are going to support you in that, because on the, in the end, this is her pregnancy, this is her, the kind of life. So we have to be respecting the patient's autonomy. I'm sure everybody knows about that. Even if patient wants to die, for something, for example, she is a Jehovah Witness. She is like, I mean, the type 4% of Hevia. She doesn't want to accept any blood transfusion. We don't have any, the cell salvage facility in our clinic, in our, the setups in our hospital. So of course, we have to respect her wishes. Let her die if she wants to. Okay, but again, you are going to be talking about everything in a very good way. Plus, you are going to justify whatever you are telling her. If she is asking you that, no, she's breech, okay, she wants to go for primary breech and she wants to go for vaginal birth. So definitely, you are not going to say simply that, look, according to our guidelines, we don't deliver a primary breech vaginally. We do go for cesarean section. Yes, clinically it is good. But if you will open your station with this, no role player is going to let you continue the station. But rather, you can simply say that, yes, vaginal delivery is certainly a good option for, the woman who is going for the delivery. But there are some, the kind of pros and cons for the, the baby who is coming with the bottom first position. So shall I tell you with all these things? And I will be telling you that, what will happen if you deliver vaginally, and what will happen if you will deliver by cesarean section. Is that okay with you? Yes, doctor. Okay. So what will happen is that, then you will justify yourself that if you will deliver vaginally, the labor can be prolonged. There can be, the chances of, the problems for the babies as well. There can be chances of, the aftercoming head. There can be chances of shoulder dystocia. There can be chances of PPH as well. Later on, so many things. So you are going to give the reason that why you don't recommend for, the somebody who is going for the breech vaginal delivery, until unless it is planned breech vaginal birth. And of course, then it's going to be the consultant decision. You can say that, yes, there are certain conditions in which we can allow somebody to go for the vaginal breech birth. We call it as planned vaginal breech birth. But for that, I need to put you in touch with my consultant, and then, we will see. Apart from that, let me tell you that, what will happen if you will deliver vaginally, and let me tell you what will happen if you will deliver with the help of cesarean section. Okay. So this is how, you are going to start your consultation for anything, because you have to give reason that why. So you can't impose your decisions on them. The second thing, which sometimes role players do ask, but not always. Okay. Sometimes, doctor, which one is the good option for me? If you were in my, the shoes, what option will you choose? And this happens in real life as well. So in that case, you can simply politely say that, it is very hard for me to, take a decision on your behalf. Okay. So, but at the moment, what I can think is that this decision can be better for you, your baby, and this decision can be a bit dangerous for you and your baby. But I will be giving you this patient information leaflet, so you can take it home, you can read, you can discuss with your partner or family, and then you can come back again with your informed, the decision. Is that okay? And if you have any question, I can, rearrange any appointment later on as well. So this is how, you are going to talk. Again, because sometimes patients do ask, okay? Yes, up-to-date knowledge is meant so smoothly. You have to be, very smooth in your, the talk as well. And this will definitely come with practice. I am not going to feed you anything, okay? I can just give you, whatever I have learned through my failures, whatever I have learned through my own experiences. So of course, with the passage of time, you become wise. With the passage of time, you become, the kind of what you can say, that a good a kind of a teacher as well. I can just only say this. So this will come with the passage of time. So inshallah, I will try to give you whatever knowledge I have. And this I always say to my all candidates, that I can guide you with the best of my knowledge. So simple. So you have to be very smooth. You don't have to act, you don't have to pretend something. They know that we are overseas, okay? So we can't be something in our exam. So doesn't matter, if you are going to fake your accent, doesn't matter if you are going to fake your personality. So it is not going to give you any kind of edge. Okay, so you have to be very smooth in your talk, you have to be very flowy, very spontaneous. That's it. Okay, so this is how you have to speak. Then communication with colleagues, this is important at this level, because we are going to be like, ST3, ST4, ST5. So we can't handle everything. I can't handle diabetes alone. I need some colleagues. So MDT approach is very much important. If you are talking about MDT, so it's better, it's a good idea that if you will talk about that, I will be involving my senior consultant, I will be involving your doctor as well. And again, please don't say brain doctor, because if it is neurologist, so for God's sake, say neurologist. If it is epilepsy doctor, say epilepsy doctor. If it is diabetologist, say. Okay, if it is physician, cardiac physician, say. I think cardiac is a very good English. So why you have to say all the time heart doctor, and kidney doctor, kidney doctor? So I think, we can simply say, if somebody doesn't understand, then we can rephrase. Okay, so consultant. And then if it is a referral letter from midwife or GP, so don't forget to write back to them. This is communication, because we all know that the care in the NHS is a kind of from primary care to the secondary and the tertiary care as well. Okay, so it is going to be connected. So you have to write back to midwife, you have to write back to GP. So you don't have to undermine anybody. Okay, so if something is there that there are plenty of scenarios in which the GP has sent a letter that in which it is written that I think that patient is having bacterial vaginosis. So it doesn't mean that you are going to undermine GP to in front of patient, that that perhaps the GP was not having the clear idea that you are having bacterial vaginosis or something. So let me just tell you, no, we don't have to undermine anybody. Undermining and bullying both are not the kind of justifiable, and of course it shouldn't be there. Anesthetist, neonatologist, you can say neonatologist, you can say the baby doctor. That looks fine, I think, but not the other terminologies. Okay, so this is important, that you have to communicate with your colleagues. You can't manage everything on your own. So it is very much important. Patient safety is very much important. You have to ask about name. And this happens, what happens is that, for example, in previous station, let me tell you, in these, the online world, when I was preparing, there was a very famous name, because our a legendary mentor, Dr. Muhammad, he used to teach and he used to take the name Tamara John. So every lady was Tamara John, every patient was Tamara John. Later, it got converted with the help of few, the mentors, Emma. Then it became Lucy. Then it became, the whatever. So what happens is that, it's going to be in our head later on. And you won't believe, trust me, in real exam, I had a case of male factor infertility, and that, the role player gave me the name John. And when I inquired about his wife, so I had to stop myself asking him that how is Tamara doing, because Tamara John was there at that time. So don't fix your head on these names as well, that if it is Emma, Lucy, Joe, anything. So just try to change the names too. So this is how you are going to be very easy. Plus in exam, what happens is that in previous station it was Emma, in this station it is Lucy. So sometimes we call them the Emma. Doesn't matter. Don't be upset. If at all you realize it yourself that, oh, I'm sorry, can I cross check your name, Elite? Can I cross check your name again? Oh yeah, Lucy, I'm sorry, I've been calling you Emma. Okay, so this is easy. If she is stopping you, so ask her permission and then say sorry. Okay, don't be upset. Sometimes candidates become upset about that too, that they are calling. So don't be upset, don't make any fuss in exam, okay, on yourself, unnecessary. These are nothing. These are, you know, the kind of petty things in exam. So all you have to do is that you have to be confident. You have to be asking about age. You have to be asking about, you know, have you been pregnant, you know, before or not, you know, or is this your first pregnancy? Living status we have discussed earlier, last menstrual period. And yes, for the last menstrual period, if in a station it is given that this is 13 weeks pregnancy, 32 weeks pregnancy, then there is no need to ask about last menstrual period, because you're not going to you know, take out your you know, the ops card and then you are going to calculate whatever is given. Okay, take it as such. If it is 15 weeks, okay, 15 weeks. If it is 32 weeks, take it as such. Okay, BMI. And for the BMI, personally, I have been to UK a couple of times. Okay, and I have been to few hospitals as well, and I have been speaking to my, you know, the many, you know, the students and the fellow colleagues as well who are working at NHS at the moment. So asking BMI is not bad as well. So it's not always that, you know, height to weight ratio, height to weight ratio. Okay, we know that it is height to weight ratio, but we can simply ask that, I mean, do you know what your BMI is? I personally never, you know, they use this height to weight ratio. But if somebody doesn't understand that, in that case, you can say that, you know, this is height to weight ratio. So are you aware of that? So if somebody doesn't know about BMI, so don't be upset about that as well. So simply ask about, do you know what your weight is? That's okay. At least you can have a vague idea about, you know, BMI or the weight, because it is important in some things, few stations. Then asking about the smear history. Again, this is very important, that if you are missing this smear history in the gynecological cases, so this is, I think, going to be bad. But if you are not asking in ops cases, this is not going to make any difference. Okay, so don't be upset in that case too. Be very, you know, the kind of content whatever you are asking at that time. So smear history, many times, you know, the I personally use, are your smears up to date and normal? So that's it. Okay. Candidates do ask like this, and there is no harm personally. Okay. No, you don't have to check, sweetheart. Whatever is given, whatever is patient saying, take it as such. In 10 minutes time, you can't check. Okay, another thing. After taking history, the candidates say, I will check your blood pressure, I will check your pulse. And then, you know, they pretend like this too. I will check your pulse, I will check your blood pressure, I will check your, I will do this, I will do this. Until and unless this is a demand of station, in that case, you can say that I will be doing this. Okay. Or if you really think that you need examination, you need investigation, then yes, you know, the examiners are there. They are going to help you with, if at all, if it is needed. You don't have to recheck anything. Remember and mark my words, 10 minutes. In every 10 minutes, you have to prove yourself. In every station, you have to prove yourself. You have to fight for every station. Even if you are losing something in one station, don't be upset about that. Fight for next station. Fight for the next station. Okay? You don't have to be upset, because the result is going to be collective. Result is going to be collective. Of course, layman, the lay examiners stations are going to be, you know, the high carrying marks, and there is no marks distribution as such. Let me be very honest with you. I have been an examiner for 3 exams. Okay, so there is no marks distribution as such. Okay, RCOG has its own keys. RCOG will give you numbers, and that's going to be on pass, borderline, and fail. Okay, and in every station there are few things which are very much important to pass this exam. For example, from the RCOG keys, if there are 3 things which needs to be addressed, if you are addressing 3 things, you are clear pass. If you are addressing 2 things, you are borderline. If you are addressing 1 or none, you are fail. Okay, so don't bother about this stupid marks distribution which is here and there. So there is no role of all these marks distribution. Okay, so don't just carried away with this. Just keep in your mind that in every station you have to fulfill, you know, the important stuff which is important. Like I have told you, then in OHSS, if somebody is forgetting you know, the NSAID use, so this is a sin. that in the hyperemesis gravidarum, if somebody is giving 5% dextrose to the woman, it is a sin. So yes, if somebody is using that, it means that you are breaching patient safety. You are not good doctor. You are not a safe doctor. So of course, you will get, you're not going to get good marks. Okay, safe medication, smear history, contraception, alcohol, smoking, recreational drugs, allergy, proper referral. This is also very much important. Okay, so this is going to be, the kind of patient safety. Then in 2 minutes time, and in online exam, 2.5 minutes time, if you get. So how you are going to utilize that? You are going to utilize that time accordingly. Okay, how you are going to utilize this? You are going to read task carefully, first of all. You are going to check what domains are being tested in this task. For example, if in any case you don't have to ask information gathering or history, so this is a good thing. You don't have to ask so many questions, because information gathering takes time, and it really sometimes makes us confused too. So read the carefully that what domains are being tested, because if this station is all about, for example, in many stations there are that that short summary is going to be there, and all you have to do is that you have to manage the case. That's it. In terms of management, if you really think that you need to know which is not given in the history, so in that case you can ask, but otherwise don't waste time. So check very carefully that what domains are being tested. Please don't start making keys. This is such a the wrong idea. In 2 minutes, it is practically impossible, humanly impossible, to make keys in 2 minutes, because I don't know what happened with previous station, and it was very bad. I'm not satisfied, and I'm mentally upset. I took few seconds to gather up myself, and then now I'm in next the cubicle, next station. So please don't start making keys that, okay, I will be asking this, I will be asking this. I will trust yourself that you have come this far, you have studied this much, and now you are going to just perform according to this station. Check if it's a referral letter or not. Formulate how you will start the station. Just, the starting point is very much important, remember. And I'm sure you all know this, that first impression is the last impression. If you will start, as a confident, good doctor, and if you will just fumble in the beginning that, I understand that, you are having this problem, and you are having this for the last 15 years, and now you are very worried about this thing. So of course, this is not going to give a good impact. Rather, if you will start like that, I understand that you are having epilepsy, and today you are here to discuss about your pregnancy care plan. Am I right? Yes, doctor. So it makes difference. Okay, it will give you good feeling as well, that if you will start in a confident way. Read question again and again, that in only 2 minutes time. I think this is the good thing, that you can read question again and again, that you shouldn't be missing anything. Okay, then in 10 minutes time, of course, this is also very much important. You have to look confident. You have to be entering into the cubicle in a calm, familiarize yourself with the cubicle. Just think that how many personals are present in this station, because if 2 examiners are there, so of course this is going to be lay examiner. Okay, 2 examiners, 1 role player. So if you see 3 people, so of course that's going to be, it means that in this case you have to be very vigilant with your performance as well, because this will carry high marks, isn't it? Don't look at examiner or low examiner at all. Don't expect any kind of the expressions. And day before yesterday, I came to know that our Dr. Hassan, okay, he was an examiner for one of our the candidate. So she was telling me that Dr. Hassan was my examiner, and I was very happy to see him. But of course, even if Dr. Hassan is there, even if you face me in the exam, of course it's not going to give you any benefit, because in online exam this is going to be recorded. You are just seeing me, but in the background there are 2-3 reserve examiners as well. You don't know that how many people are giving you marks. So in the end, this is going to be a kind of collective result. Just focus on role player. Don't look at examiner. Don't expect that that you will be expecting that there is going to be any shabashi or something. Yes, you have done very good, bravo, you have done very good. No, nobody is going to give you any hint. Okay, Just try to finish your task with respective domains. Even if you think that you have finished your station before or earlier, before the bell rings or before the time is over, sit comfortably. Don't, change the posture. Don't make faces. Don't just, look here and there. Just, stay calm. Okay. Just look at the screen or look at, on your lap. That's it. Don't make unnecessary movements. Don't exchange glances. Don't be, don't give your smiles as well with anyone in the cubicle, even if you have finished your station early. And that happens in structured discussion, trust me. Because sometimes what happens in structured discussion is that you are just speaking, and sometimes you can finish if you are very well versed with that station. So you can finish in 8 minutes, you can finish in it like 7 minutes. So that is pretty normal. So don't think that you have performed bad or you haven't done, until and unless that you really have performed bad. But if you have performed well, if you know that I have said everything, then if examiner will ask you, do you want to add anything, would you like to add anything? So don't just try to give the lame things, lame the kind of here and there things. So just simple, just rehearse in your mind, then you can say, no, 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 sir, no, I'm done with this station. All right, that's it. You don't have to be like upset if somebody is asking you. It doesn't mean that if somebody is inviting you that okay, come and speak again. No, you don't have to do. So this comes the overview of the exam. I hope everything is clear. If something is not clear, please ask me. Is it clear, everyone? If there is any question, please do ask. No question? Yes, they do. They do ask. Okay, sometimes they do ask. And they are just asking you to utilize your time. They are not inviting you to add something. Okay, we will practice, Athiya. Don't worry. We will practice in our sessions. Don't worry about it. Okay. Yes. Yes. I'm coming to it. Okay, I'm coming to it. Okay. Okay, great. So, how to start preparation? Very important question. First of all, you have to organize yourself. First of all, you have to be clear in your thought process that which exam do you want to go for. Okay. Yes, please ask question. Hafiz aware stream. Yes. Yes. Is there any question? Okay. So please ask. No problem in that. Organize yourself. First of all, organize yourself mean because exam is completely. I'm coming to this point. Okay, I'm coming to this point. This is called organization. Organize that how you are going to organize yourself. Okay. Of course, everybody has different, the life. Everybody has. We can't fit in anyone's shoes. Okay, we can't relate anyone's life with our life. Okay, we don't know how somebody is going through in his or her life. So the person who is aiming for exam, surely he or she knows that how much time I can give and how I can prepare. But roughly, at least 3 to 4 months dedicated study is necessary for this exam. 3 to 4 months. And when I say 3 to 4 months, mark my words. Why? Because after passing part two, you are fresh. Your knowledge is fresh. All you have to do is that, by this time, even being an overseas candidate, we know basic English, isn't it? I will repeat again. This is not English language exam. This is not, being an overseas, we will be like Britisher or we will be like Americans or something. Trust me. Even if you don't know, the good English or something, you can just communicate. All you have to do is your communication should be good. At least you should be able to, convey your message. Plan when you think it is feasible for you in all circumstances. For example, you are doing job and which is very demanding and you hardly get time to study. You are a mom or you are a father or you have some kind of responsibilities, of course. So you need 3 to 4, more time than that, of course. But if your job is not that demanding, And if you think that you can take out time, and at least you can take out 2 to 3 hours on daily basis initially, and then later on 5 to 6 hours, religious practice. Religious practice means that, at least you have to practice. Until and unless you will speak, you're not going to be corrected. I am not like this, Dr. Zaid, what I used to be in back in 2018. I was a candidate like you guys as well. So I have learned with the passage of time, of course. So I have learned with the passage of time how to improve. Till date, trust me, till date, I do try to improve on myself, on my communication skills, on my knowledge as well. I do try to keep myself updated with so many things as well. So it is very much important. So the next thing comes is, now you have decided that, now just somebody asked me that, how to organize for November exam. So November exam, so you have got plenty of time, isn't it? So organize yourself. Good. It is good that you have thought for November exam. So it means now you can start slowly, take a step. Okay, just learn that how you are going to start. Make a comprehensive schedule for yourself, keeping in view of your job and household responsibilities. Look for a good study buddy. This is very important. This is very much important, in fact, who is ready to take burden of this tough schedule with you, who doesn't undermine you and make you feel inferior and make you feel, low in your preparation as well. Because this is very bad, if somebody is undermining, if somebody is, all the time, wants to perform, and he or she doesn't give you chance to perform as well. Because what happens is that, we have got couple of books in which, we have, some scenarios. So I always advise that, if you guys are like, 2 or 3, the friends, so you can make a, the group, and even 2 friends are okay. So what happens is that, for example, I have started off with antenatal care module, and I have picked, the few books, and I'll be showing you, the books as well. So in one station, one can be the role player, one can be the candidate. In second station, one candidate and the other vice versa. Okay. So this is important. Sometimes what happens is that, everybody wants to become candidate, nobody wants to become role player. So sometimes, this is going to be, the pessary insertion, trial and error. So, I mean, finding a good study buddy is also a trial and error. You can just try, and if you think, your frequency doesn't match, your time zone doesn't match, you think that he or she is undermining you, and if you think that, you don't keep up with him or her, so politely excuse. Don't just be, the kind of rude, or don't just be quiet, or just give your reason, and then, just be on one side. Because this is a kind of, the way where you are going to show yourself as well as a human being, that, practically how good a human being you are. This is not all about exam, because not, the whole life we are going to give exams, isn't it? And this is a globe, this is a very short world. Trust me, the small world, in fact, not short, sorry. So this is a very small world. We may see, so many people, so at least, we should be giving a good impact to, one another. That at least, if we see somebody, so at least we will be in good position to, say hello, hi, or do, some kind of chit chat. Okay. So again, don't be upset if somebody doesn't go well along with you. Look for another study buddy. And if you think no, so don't worry, study with yourself, talk to yourself, like I'm talking to you at the moment. Okay. Take, the Zoom application, the kind of subscription. Talk to yourself, record yourself, listen to yourself, improve on yourself. Take 1 or 2 good courses if you think that, you can take. Okay. If you think that you can manage, then it's good to go. Okay. Record yourself and listen to yourself. Trust me, nobody can judge you more than yourself. Nobody can criticize you more than yourself, because we all know that what our weaknesses are, what our strong points are, isn't it? So don't be upset if you think that you don't go well along with any study buddy. So it is going to be again the trial and error. You can always choose whichever, the study buddy suits you. You can make templates if you can, and revise them in the end of your preparation. But again, making the templates is good idea, and personally I like it, but I don't endorse it. Okay. I don't force to anybody that, okay, no, you have to make templates and then you have to, start your preparation. This is going to make you good candidate. No, you are going to be a good candidate when you are going to practice, when you are going to speak, when you are going to talk, when you are going to do the management, when you are going to rehearse. Okay. Yes, templates are going to be helpful, but of course you can't be me. Okay, you can't be anybody else. I can't be you. You yourself are unique. Maybe your communication is much more better than me. So don't fall for this prey that you have to go for the ready-made templates and then you can just the memorize and then you will just go for this exam. Do all available stations in books. Okay, so this will give you good practice moreover. Okay, so according to your feasibility, you can take 1 or 2 online courses, and because this is not on-site exam, so once it is going to be on-site, so it is a good option and it's a good idea that if you take on-site course as well, because it gives you a very good, the thorough insight of the NHS system. Master on communication skills and revise your syllabus. It is very much important. If somebody doesn't know that what exactly the OHSS is, so it doesn't matter if he or she is speaking so fluently. This is not going to help me if she doesn't know about OHSS. Okay, so this is very much important. So studying with the study buddy is very effective because it will give you the different perspective. So if it is a sincere study buddy, if he or she is very much dedicated like you in your studies, so yes, he or she will highlight your weaknesses, your strong points. He will uplift you, he will give you support, he will be guiding you through that. Look, we have to work hard on this, we have to do this. Let's find out what is the safety point in this station. Let's find out how we can improve on ourselves. This is the beauty of study buddy. So if you will be a good study partner to someone, so of course someone can be a good study partner. So be a good person or good study partner yourself first. Okay, so then you can make the some kind of study with fun as well. I remember when I used to study with my partner, and the Jeep is here, and we used to study for our MRCOG exam, European board exam. We used to make a lot of fun, we used to crack so many the jokes, nasty jokes too, and we used to laugh, we used to study. And yes, it gives you good feeling as well in the end, that you are not being robotic, you are a human being. Yes, you need jokes, and I'm sure we all are doctors, and sometimes we do have very the good sense of humor as well. So we can crack jokes and we can laugh, and there is no harm in the laughing and keeping the environment light and the study light as well. So um, again we have to build each another. Okay, we have to build our partners, study partners too. So we have to improve on motivation and willingness to study. Sometimes what happens is that if I'm feeling low, that if I will tell you that I don't want to study, I'm feeling so bad because I didn't practice and I didn't study in the morning. So what is your job as a good study partner? That you will uplift her. You will say that I understand that you are feeling low. Let's study. And if you think that you can't study, then we will leave and we will start it from again tomorrow. Okay, it's not like that. She's not studying with me. Okay, she's not a good study partner. Okay, I'm going to look for another one. So this shouldn't be there. Okay, so at all times sincerity, willingness to help, willingness to study, motivation should be there. No undermining, no bullying, no the kind of making somebody inferior in terms of anything, because this is exam, and of course this is exam of nerves as well. This is exam of our ethics as well. All right, so at all times we have to be very good human being and then study partner as well. All right, so the curriculum syllabus, again we have got 12 clinical modules or 14 clinical modules, you can say. Sometimes the many modules will overlap. Teaching stations can be there, core surgical skills can be there, post operative care, sometimes core surgical and post operative overlap, gynecological problems, benign gynecological problems, sexual and reproductive health, okay, self-fertility, early pregnancy care, antenatal care, maternal medicine module. Sometimes antenatal care and maternal medicine module can overlap. Postpartum care, management of labor and management of delivery. This is important. Clinical governance topics, audit, risk management, okay, the What else we can have? These days, the critical appraisal doesn't come in the MRCOG curriculum, but yes, audit comes, risk management comes at times. Okay, so at least we have to have a good idea. Yet again, if somebody doesn't know anything about the audit or risk management, so don't worry about that. You have 13 rest of the modules, so master on those 13 modules. So why taking unnecessary stress for only audit one station and compromising your 13 other stations? Being an exam candidate and a MRCOG candidate, let me tell you, me myself as an MRCOG candidate, I have never done biostatistics in my whole life. Okay, I have just done clinical governance, this audit and risk management only this year, when I have become examiner myself and I have to improve on, I had to improve on myself. Then I did start, this audit and risk management, that, what is the basic concept, how we are going to do. And then I did, some stations, and alhamdulillah, so far it was very good. All right. So again, you have to master on all these basic, first of all, you need to understand what exactly the basic station is, module is. Then you have to follow the basic template of the history. Okay, for example, in core surgical skills, if it is a laparoscopy consent, if it is a the kind of hysteroscopy consent, or if it is cesarean section, so of course you need to understand consent advices. You need to know the consent advices. And again, in consent advices, don't say that it is going to be 10%, 13%, because you have to say in a very patient friendly language. You can say 10 out of 100 women can have this problem, 13 out of 100 women can have this problem, and this is a very serious complication, but it's a very rare complication. Okay, so I mean, yes, and of course this will come after thorough practice. So simply you can make the schedule according to the modules as well, or according to the books as well. So this will all be that how you are going to cram up your curriculum or syllabus. Then you will follow instruction, then you will assess yourself, then you will definitely be in a good position, that where you can be a good candidate. So like I said earlier, that we have to do some books, because the tasks are there. This is a recommended books by RCOG, Part 3 MRCOG Essential Revision Guide, Lisa Joel. Very beautiful book. I will recommend all of you, and to the Akhi and the other candidate, the Awais. So you guys can, open this, the chapter, this book. You can read chapter number 3, or you can read first 3 chapters thoroughly, to get a hold on this MRCOG Part 3, how it is going to be. Then it has got, I think 14 stations and 4 stations in the end as well. And it has got, the videos too, and videos are available on internet and on various groups too. So you guys can watch them, you guys can learn. So, the 14 stations for, how many stations are there? 18, okay? In this books, roughly 90 cases are there. In this book, I love this book. I literally love this book. Although this is an old book, but I love this book in terms of, because it has got very good structured discussion task. Okay, structured discussion task. So 50 cases. So you can just count 28, 90, 50 cases. Very good. Get through. It has got 2 circuits completely, 14, 14, 28 stations plus I think 4 more. So at least 32 stations. It has got the 5 papers. So 5 papers will have 14. So how many? 70 stations here. So 70 plus 90 plus 50 plus 28 plus 32. So isn't it a good practice to do all these stations? Oxford Specialty Task Book, Atiya, this book. Oxford Specialty Task Book. Okay. It has got almost. So I think, isn't it the good idea that if you are having almost 200 plus stations, so do you think exam is going to be out of this syllabus? Do you think that exam is going to be out of all these questions? Even if it comes, so at least by doing all these practices on these stations, at least you will be clear in your mind that even if any untoward station comes. Let me give you an example, my example, and I do give you this because I only have my example in front of me, because nobody tells their weaknesses. Okay, So what happened when I was going for my second attempt? Okay, I was well prepared, of course. Okay, and it was a very good time for me because I was practicing, and I was doing the clinical job as well. So anyhow, I did complete maternal medicine module. I didn't leave any station, but I didn't do one Willy Brandt disease. Can you imagine? It was my fourth station in real exam, one Willy Brandt disease, and I was like, oh my god, I'm going to fail again. This is going to be a disaster again. And I could not afford failing this exam because of the multiple reasons. And one of the reason was the very strong, because I don't want to say that. Okay, so it was very important for me to pass exam. So can you imagine that I did prepare everything, and somehow I didn't do this the von Willebrand disease task at all, and I have left it for the in the end of the revision, but somehow I couldn't do it, and it was in front of me in exam. But then later on I gathered up myself. I said that no, I have to fight for this station too. So I did start with the my background knowledge of part 2. So alhamdulillah, it went well, and I scored very good in that the attempt. So it happens, and it is normal, but all you have to do is that at least you have basic concept that how you are going to go for maternal medicine module. And then you can ask the role player. You can be smart, you can be like, I mean, Atya was telling me that you speak so smoothly. So at all times I was asking role player that would you like to tell me how can I be of help to you today? I understand that you are the pregnant, and you are here to discuss your pregnancy care and all. So is there anything particular you want to talk about? So I invited her. I asked in an open question. So she gave me the idea that yes, I want to talk about that how one millibrand is going to affect me, my baby, and blah blah blah. So I knew the basic concept that it is an inherited condition. So we have to screen partner, and somehow from the part 2 knowledge, I knew that there are some safety checks for heavy lochia. We have to give tranexamic acid. We don't have to give IM injections. We don't have to perform any instrumental deliveries. So yes, that helped. I think that helped a lot. So all you have to do is that you have to move forward with your basic concept and knowledge. So I think you can go through easily. Then of course it will come with the practice. So you have to prepare well for your big day, and then you have to ace it, and then you have to be legible for your degree, of course, MRCOG. So practice, the more you practice, the better you get the result. Okay. And MRCOG part 3 is all about practice. MRCOG part 3 is all about how you behave in exam. It's not about, again I will emphasize on, please don't take me wrong, it's not all about templates and all. It's all about that how you are going to behave in exam. Okay. Any question, guys? I think I have been so, the brief in telling each and everything. If still there is any question, I'm open for all questions. Any question? Okay, very good. Neha, is it clear to you? Manahil? Okay, okay, thank you so much. Okay, very good. So still, if something is not clear, you guys can ask me. You guys can send me message. You can guys can ask me in person too. Okay. Hi, Sana. Good to see you. Okay. Very good. Very good. Thank you so much for your appreciation and kind words. I really want to help. And if somebody needs, help in person, you guys can reach out to me. And I'm not going to talk about, the so much of, the courses and all. You all know that, there are courses going on. And yes, we are going to have the crash course for the May exam too. We are running our, the regular course for May exam too. And the crash course, me and Dr. Hassan, we both will take, of course. Okay. And we both are examiners. And somehow I think we can give good insight about the exam. So yes, looking forward that if somebody wants the kind of attention in this, I don't say that somebody needs help. Everybody is kind of capable enough. All you need is proper guidance. Okay. So just choose wisely. and prepare wisely, stay focused. Don't just drool over so many things. Drooling over is not good. Okay. Antihypertensive medications you can change, or you will refer to specialists. No, you can change. We know that, enalapril, if you specifically are asking about, you can, refer, because, the antihypertensive medication somehow, we can start with labetalol as well ourselves, and we can refer to both things. It's not a, the hard and fast, the criteria. Because antihypertensive, we know that, in pregnancy, we have to give labetalol only as a first line agent. So we can say that, we will put you on some safer pregnancy, the friendly medication. Plus, we will put you, we will, keep your specialist in loop as well in your care. So that's okay. Okay. Great. Any question? This was a very good question. Any other question, guys? Thank you. Thank you so much. Thank you so much. So just be yourself. This is going to be my closing, the statement for this session. Be yourself, be confident. Don't try to, the imitate. Don't try to be somebody, okay, which you are not. Because sometimes what happens is that, if you will lose yourself in the middle of the station, so definitely it will affect your performance. Because end of the day, this is just your exam, okay? End of the day, nobody is going to judge you except you yourself. Okay, so be yourself, be confident. That's it. This is all I can say. Prepare well, and decide well that when and how you can go for exam, and that's it. Sometimes there can be bad patches too, so don't just be the disheartened. And yes, nobody wants to fail, and nobody wants to fail at all in our the what you can say that in our the doctors fraternity, because almost we all are the competent doctors in our respective the countries. So of course, if we are doctor, if we have come this far, so of course we don't want to become we don't want to come as a failed candidate. But on the other hand, we are competing with the brains throughout the world, of course. Okay, so when it is going to be a collective result, so of course it means that we can fail, or we can lose this exam by the tiny marks, or tiny the differences. So just again the gather up, just the go for exam. HIV azoospermia, you will ask patient that is someone with you. No. HIV, if you think that this is pregnant, and you are going to take the confidentiality first. Okay, you are going to say, you are going to tell her that I have your reports with me. Do you have any idea what exactly is in the report? No. Okay, so we have done a couple of tests on you, which we do offer to all women who are coming at NHS, and HIV is one of those. And unfortunately, the HIV test is positive. So because if HIV test is positive, so most of the time in exam stations, what I have seen myself is that there is going to be the history. Patient must be knowing that she is either a HIV, she is in HIV, the partnership or something, or she is a multiple abuser or something, or she is in the sex worker, commercial sex worker. So sometimes it happens. Azoospermia. Look, sweetheart, if somebody is having any problem, for example, this is azoospermia. So do you think if I'm having azoospermia, I would like to involve somebody? This is my personal problem, a big problem. I am not going to involve anybody. Simply, you can simply say that, I have a very difficult news to tell you. And, we have seen, we have done a semen analysis on you, and we couldn't find any sperm in your, the semen sample. And the condition, we call it as azoospermia. Do you have any idea about it? Because like Dr. Hassan says, and I really like it, not azoospermia doesn't mean that the male is infertile, because there are types of azoospermia, isn't it? Obstructive, non-obstructive. So of course there are chances that we can retrieve sperm. So it is a kind of BBN, but it is not BBN. And please don't involve in azoospermia. If it is a tubal blockage, likewise, So I'm sure if I'm having tubal blockade, I'm not going to involve anybody because this is my very personal thing. Even until and unless, you know, my partner is here, my husband is here, then in that case, you know, you can ask that, you know, do you want me to disclose the reports in front of your husband? So you will simply ask. There is no harm in asking. But for the azoospermia and HIV, I don't think, you know, we have to involve anybody. Until and unless for HIV, the patient is persistent and she's consistent, no, 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 I don't want to involve anybody. And, you know, I don't want to go for HIV testing. And if you think that she is at risk of giving this HIV to multiple, you know, the patients, multiple, you know, because of her, you know, the job nature. So of course, in that case, you know, then you will say, first you will convince her that, look, you know, this is not good. Look, this is bad. Look, this is very bad, because, you know, if HIV is going to spread like this, you know, that unknowingly, involuntarily, that you are going to, you know, give this HIV to many people. So don't you think that it's a bad idea? So, you know, in that case, you can breach the confidentiality. If she doesn't, you know, agree on telling or disclosing this HIV status, so only in that case you can say, because this is now your job, that you have to prevent other people from getting HIV. Okay, Salma? Okay, okay, great, great, good questions. Any other question, guys? Mm-hmm. Okay, so if there is no question, so I will end the session with this, you know, the wish that you guys will prepare well for this exam, and you will, you know, prepare with full throttle, give your 100%, and then of course, you know, we have to leave something, you know, to the upstairs, you know, the God. Of course, we can't decide, you know, anything on our own. If she doesn't agree, so what we are going to do next? If she doesn't agree at all, that in that case you can say that, you know, keeping in view of the, you know, the high nature of sexual transmission of HIV, I will have to involve, I will have to, you know, talk to your partner regarding this, and I may send an anonymous letter to your husband to just go for this HIV testing. And this happens, okay? We do send, you know, the anonymous letters that, you know, that you are at risk and you have to go for HIV testing, okay? Or even, you know, you can openly break, and, you know, somehow, you know, these stations will just test that, you know, how you are going to deal, because this is going to give us idea about your communication skills only. That's it. Okay, again, play safe, be safe. That's it. Mm-hmm. Okay, okay. Thank you so much, guys, for being here, and all the very best for your preparation, and for the people who are going for exam, and for the people who are waiting for, you know, the exam results. So, you know, the be patient, be confident, just pray. Whatever has happened has happened. Now you just have to wait for the result, okay? And whatever it is, embrace it. Whatever it is your result. All right. And of course, you know, if somebody need any kind of help from my side, you guys can always reach out to me. And of course, you know, we will be seeing, and I will try to arrange some other sessions as well, because I really get, you know, a lot of messages that, you know, we do really want sessions. So I will try to take, you know, some other sessions too, perhaps on some difficult scenarios, perhaps on some, you know, the exam recall question as well. So I will try to take. Okay. Okay, okay. Hi, Shaista. Good to see you. Good to see you. Good to see you. So I feel very happy when I see, you know, very familiar names, familiar faces. So thank you so much, guys. All the very best for your preparation. Thank you so much. Do join our free groups. Okay, we are having, you know, the good activities in our Telegram groups for part 3 as well, and of course in WhatsApp, in Facebook, anywhere, you know, reach out to us. All right. Okay, bye bye. Take care. Good night.